have the Minister and Departments of Local Government, as well as Disaster Management and the Department of Environmental Affairs and Development Planning. So a full meeting today. I am informed that we are quorate. We will start with some apologies first. I have received an apology from Honourable Windvogel. Are there any other apologies? None. No other apologies. We'd then like to ascertain whether there are any registered alternates that will be standing in.
Yes, Chair. Yes, Chairperson.
Yes, Honourable Lecker.
Member Ted Maran is standing in now to the IT personnel to get him the PIN code.
So Honourable Moran is standing in for Honourable Windvogel.
Yes, Chair.
Okay, got it. Thank you. Right, before we get into the meat of the meeting, I'd just like to indicate the rules of engagement for our virtual meetings of the WCPP. So all members and participants are muted at the beginning of the meeting to avoid any background noises. If a member would like to speak or would like to raise a point of order, would they kindly use the chat function on Microsoft Teams? The chat function is only for raising points of order. All audio and video should please be switched off, which will help us improve the quality of the meeting. However, those persons presenting, the Minister, the HOD or officials, please feel welcome to keep your camera and of course your microphone on. And then we ask, once you've concluded presenting, if you could unshare and then also turn video off. And I think that's it for the rules of engagement. We say a very warm welcome to you, Minister Bradell. Thank you very much for attending the standing committee or this ad hoc committee, and to your teams. We know that there are quite a number of pressing issues, and we've asked for a very long list of things that we'd like to hear or learn more about. So thank you very much for your time today, and to your officials. I wonder if you would be able to introduce your team and perhaps make some introductory remarks.
Thank you, Honourable Chairperson. And maybe I'm going to, do you first want to introduce the team, or can I just start with the introductory remarks? And then I will hand over to my HOD. I think it's difficult to introduce now the whole team.
Up to you. Thank you.
Okay. Honourable Chairperson, honourable members, ladies and gentlemen, thank you and good afternoon. Globally, the coronavirus continues to kill people and cause severe disruption, including shutting down the global economy. In South Africa and in the Western Cape, we are now increasingly being impacted. I want to take a moment to extend my and my department's condolences to those who have lost loved ones in this virus. Honourable Chairperson, the Department of Local Government in the Western Cape continues to be one of the key departments tackling this pandemic in the province, and I want to thank the head of the department, Mr. Graham Paulser, and his colleagues and all their partners for the ongoing efforts. I must strengthen this, that it's all the partners. We've got brilliant partners who support us, who help us through this crisis. I really want to thank all of them. The department's people jumped in from day one and continue to work hard for the communities of the Western Cape. The Department Disaster Management capacity is once again front and center in this struggle. The Provincial Disaster Management Centre Joint Operations Centre was activated on the 24th of March 2020 in terms of the Disaster Management Act and continue. Thank you, Honourable Duckmore. According to the Disaster Management Act, and continue to support and facilitate a multidisciplinary approach, bringing together all the stakeholders working on this pandemic. The Joint Operating Centre is responsible for the operational execution of policy decisions by the Cabinet, and they are fulfilling a big role. I want to commend the head of the centre, Mr. Colin Diner, and his colleagues for a job well done. Chairperson, when it comes to our 30 municipalities in the Western Cape, I'm very proud to report that the delivery of basic services in all our municipalities are continuing uninterrupted. From frontline and essential workers are in place and operational, and all frontline staff has been issued with PPEs. Some additional measures that the department has undertaken include supplementing the water supply to vulnerable communities in the form of water tanks as provided by the Department of Water and Sanitation and in collaboration with the Department of Human Settlements. We remain most concerned about the continued humanitarian crisis arising from this lockdown as people can't work and gain an income. Their food security across the province is under threat. This threat is increasingly daily. Our municipalities, aided by many partners from the private sector and the NGOs and churches and many others, have stepped into the breach and are providing food and shelter to those hardest hit by the realities of this crisis. Chairperson, I want to highlight some of our municipalities, the George municipality, who are feeding more than 20,000 people per day via 137 municipal soup kitchens in that region. The Mossel Bay municipality has to date provided more than 412,000 meals to their vulnerable communities. In Swellendam, the citrus farmers in the area are donating approximately 30 tons of citrus each week throughout the lockdown period, which is distributed to various towns in the district by the municipality. These are but a few examples of the work being done to feed our people across this province. A few weeks ago, the department released the local government support grant aimed at augmenting and supporting all these humanitarian initiatives. An amount of 16.2 million rand was reallocated and disbursed to the municipalities with the focus on those most vulnerable. I want to assure this House and the public that this department and the Western Cape government will continue to do whatever it takes to help our communities and we are shamelessly helping those most vulnerable first. I want to end on a cautionary note, Honourable Chairperson, for noting by this House, and that is the fact that we do need to keep an eye on the financial sustainability of our municipalities looking forward. Western Cape municipalities are slashing budgets, they're cutting rates and providing financial relief to consumers who are under pressure. And this comes at a cost to the municipality, a cost that may see an impact on future service delivery by municipalities. So myself and the department is keeping a very close eye on municipal finances with our partner, the Department of Finance Treasury. With those few words, Honourable Chairperson, I wish you all good health, stay isolated and wash your hands. And with that, I'm going to hand over to my HOD, Graham Paulse, to do the presentation to the Standing Committee.
Thank you very much, Minister. Just for clarity and for the committee members, we're going to deal with the briefing on local government and disaster management first. We'll then have a question and answer session, and thereafter we'll move to the briefing by the Department of Environmental Affairs and Development Planning and have a Q&A session on that thereafter. So,
just a point of order.
Honourable Dugmore.
Thank you, Chair. No, I would just like to convey my apologies to you, the MEC and the meeting. I didn't realize that my phone was on when he was talking. I'm sorry about that.
Thank you very much for that. I'll now hand over to Mr. Graham Paulse, Head of Department. Over to you, sir.
Thank you very much, Chairperson. Good afternoon, Minister and members, as also my other colleagues. Chairperson, with your acquiescence, how do we wish to approach the presentation? It's a combination of all the parts and the Chief Directorates, the work that's been done in the department. So I'm going to ask one or two or three colleagues just to come into the presentation and to present, particularly in relation to the work they've done in response to COVID-19 in the province. And then perhaps with your acquiescence towards the end, there's just a a live demonstration that we wish to give on the application that has been developed by the department to track some of the support that we've given to particularly municipalities in the area. If you're in agreement with that, I can proceed, Chairperson. Thank you.
Thank you very much. Please do proceed.
I'll just bring up the presentation. Just check with, is it that one? But now I'm just, okay. I think I'm on the wrong. I don't just get to the back to the beginning.
Okay. I can see the slide. Are there any members that can't view the presentation? Great news. Thank you very much. Please proceed.
Thank you, Chairperson. So just by way of introduction, I first just want to reflect on the structures and the institutional arrangement in response to COVID-19 from the Department of Local Government. So the National Minister has issued a circular, what we call a Circular 10, to give guidance around the national, provincial and local structures that need to be established. And as you can see on the slide, we talk about the National Command Center and the reporting lines to the provincial, the National Command Council, the National Command Center, and then obviously to the National Disaster Management Center. And on the provincial level, also the Command Council, the Command Center, and also the Provincial Disaster Management Center. And on a district level, you find the District Command Council and the Command Center, as well as the District Operating Center. So, Chairperson, this has been this structure has been formally adopted in the province by Cabinet, and it has been implemented within the province. Just the next slide, it shows on the provincial level that we have the Provincial Command Council, which actually consists of the Cabinet at this moment, led by the Premier in the province. We then get the Provincial Command Center, which is the PTM, in other words, Provincial Top Management, which takes responsibility for the administrative accountability. And then we have the Provincial Disaster Management Center, or otherwise called as a JOC, that deals with the coordination of the operational response and the emergency response. On the same level, that has been duplicated on a district level, and I'll speak to that in a moment. On the provincial level, in terms of the command, the Provincial Command Center, these are the work streams, or otherwise the substructures that have been established. And via the Command Center, they are reporting into the Command Council on a provincial level. So you get the Department of Health leading on the health response, humanitarian and social response. That is led by DSD together with Culture Affairs and Sport. Local government and disaster management response led by ourselves. Business and economic response that has been led by economic development and Minister Meneer. And then safety and security led by Minister Fritz and his Department, Community Safety. Infrastructure response deals with the Q&I sites, and that's led by Transport and Public Works Strategy, is led by the Department of the Premier together with the Provincial Treasury, as well as Finance, Administration and Institutional Support. And then communication also dealt with by the Department of the Premier. So those are the work streams, and they report into the Cabinet thrice a week on that. So, Chairperson, Minister, members, what we've also done before we've institutionalized that arrangement, the Cabinet has also adopted the principles of the JDA, what we call the Joint District Approach, and that is on a national level referred to the District Development Model. And I think the National Minister has also encouraged ourselves to adopt that methodology in response to COVID-19. So we've also dealt with that and implemented that, and I'll speak to in a moment on the next slide of it. So this is what we've done in terms of the joint district approach, or otherwise the district development model approach to COVID-19. On a district level, you've got your JOCs, and in your JOCs, We also have at the local level your local operating centers, and they report to your district DMC clusters. And in the district level, to the extent possible, they've also established either clusters or certain work streams within the district JOCs. The district JOCs then report to what we call the DCF Tech, and that is where the district MM chairs with a balance of the local MMs, and they then in turn report to the DCF meeting where the district mayor chairs with the local mayors, and then obviously the district mayor then submits reports at regular intervals to the Minister for Local Government, Environmental Affairs and Development Planning. So that is just the joint district approach to COVID-19. And in the same way, we also respond our interaction with municipalities in this regard. Sorry. So the Department of Local Government will play a key role in terms of the interface between the national departments, provincial departments and municipalities. And you can see at the left-hand slide the way we interact and what the interface looks like. On a regular basis, myself and the minister meet via Teams three times a week with the district mayors and the district MMs to actually deal with matters in relation to COVID-19. Myself and the minister will also meet with the district mayors, but also the local mayors and the local MMs at least once a week. And then on a PTM level, on the administrative level, myself together with the DG and the rest of the PTM members, as well as the MMs, will also meet once a week to discuss matters in relation to COVID-19, to deal with any challenges in relation to any municipality or any district for that matter. This is just a narrative that explains the interface with the balance of the municipalities. And this is more or less the narrative that supports those slides in terms of the institutional arrangements as well as the structures within the province, both from a provincial level, district level, as well as a local level. Now, Chairperson, what I want to do is I'm going to just hand over to Colin, but Colin will deal with the JOC at the Disaster Management Center and the coordination in relation to the operations and operational level of the work that the JOC is doing. Colin?
Thank you, HOD. I just want to start off by saying that the Provincial Disaster Management Centre, as mentioned by Minister Bredell, was activated 24/7 on the 24th of March in terms of the Disaster Management Act and the regulations that were promulgated along with it. So the response for the is led by the Department of Health. They are responsible for the primary activities and operations in this whole process. However, the role of the Disaster Management Centre is to support the Department of Health and to facilitate a multidisciplinary process and approach, which I'm going to get into a little bit later. Obviously, the main focus, and although we do quite a bit of response work, our primary focus is on the prevention and mitigation. In other words, the containment of the disaster. And we are responsible for carrying out policy, not obviously the operational execution. Next slide, please. Okay, so as I said, we've started on 24/7 on the 24th, as mentioned in the previous slide, but since the 20th of March, we were actually started working operationally in terms of our planning and preparation of the Disaster Management Centre. We implemented a cluster approach, and I think at all levels there is the cluster approach, which just gives us the opportunity to have what we call a multi-agent command. So our first process that we always do is we look at what our risk is, and then we determine our objectives based on the risk. So the most prominent risks from the initial assessment is the pandemic, obviously, and the potential panic that it created, the social distancing challenges, the impact of any other potential disasters. So it was right at the end of our wildfire season. We had to manage a number of serious wildfires. Our weather reports long-term have not been very good, so we have to consider the fact that the province is still in a drought situation. And obviously with rain happening and xenophobic attacks, the Disaster Management Centre has to look at all those issues, along with the fact that we have to deal with COVID-19. The water and food security, the exposure of informal settlements, public disorder and crime, the socio-economic circumstances within the unique South African context. We had to look at the population at risk, and then obviously the people that are having other comorbidities, underlying illnesses, immune deficiencies, etc. So that added to the risk that people are placed. Poverty impacts, the fact that we're entering the winter season and the seasonal flu and the impacts that can have, and then also the impact of this virus on public transport hubs and means. So a major impact on not only health, but safety and economy. Next slide, please. So we decided on the following clusters. Obviously, Department of Health and PDMC have got are the main role players in terms of this disaster, as I mentioned earlier. And we then decided on the following clusters to assist: education, transport and logistics, communication, social, government continuity and advisory services, safety and security, business, economy and tourism. And then through all that obviously runs communication, which touches on each one of those specific clusters. We'll run through just their roles operationally in a little while, just to show how our system works and how it reports into the structures that Mr. Paulse has described, as well as the national system. So the clusters on the left-hand side, we initially met every day. So we would have a JOC meeting every single day where every team would report. And because it's operational, there were basically 3 objectives in that meeting: what we've done in the previous 24 hours, what we'll be doing in the next 24 hours, and what needs to be escalated. So those are the main points that were dealt with. We have since, although we still receive reports every single day, which go out to various role players, we have decided that due to the workload on these various people, is to have these meetings every Monday, Wednesday, and Friday. It is chaired by the head of the Disaster Management Centre, as well as the head of emergency medicine, disaster medicine, Dr. Wayne Smith. From the activation, we then decide which of these points have to be raised, and then they go up to the committees as described by Mr. Paulse, as well as Cabinet if required, and then we also report to the National Disaster Management Centre. Next slide, please. So the objectives, and we have to understand that these objectives are in support of health. So although a lot of these different departments have many objectives, these are specific to the Department of helping health in the COVID-19 response. So obviously health is the planning for the prevention of infections, the management of infected patients. The education cluster is specifically looking at contingency planning. A lot of work goes around the protection of schools in the lockdown period, the feeding programs, and then the preparation for the reopening of schools. The transport cluster, we have put a system in place at the Disaster Management Centre. We've dedicated an entire area where we have cameras on all the public transportation hubs, and we have a rapid response from 3 o'clock in the morning until 9 o'clock through that rush hour period when the movements are taking place. Social cluster is the support to the vulnerable groups around food delivery, around coordination of that. So it creates a very good system for us, where together with the social cluster, we have all the districts in the Disaster Management Centre, and we are able to, in real time, make the kind of decisions and create the kind of responses that need to happen. Safety and security, we have the South African Police Services, as well as the South African National Defence Force in our centre, who will respond to safety and security issues. We also have communication with state security, who assist us in terms of early warnings and certain issues that we might need to advise or respond to. Government business continuity and advisory cluster. Obviously, there is a business continuity component within government. There are issues around the welfare of the staff. There are different challenges that we have now that we've taken staff and working on 24/7 basis that they have to advise us on. So we have to make sure that those systems are in place, and that's where they come in. Also, we have to sometimes refer quite a lot of issues for legal advice, and that is where they have a system together with SAPS that they can provide us with whatever legal advice we require on a pretty much daily basis. The government communication cluster provides the communication not only between the different structures, but also the public communication. Then the business economy and tourism have done quite a lot of work and support with us as well, specifically around the repatriation, which I will be talking about a bit later, as well as the isolation sites. And then the disaster operations recovery, which has worked very much on the issues of the disaster grants. So next slide, please. So what we've done in the isolation and treatment process is we've identified those 6 levels of treatment, isolation, etc., that is required. And this is really the basis that we work on. So every day we receive a huge amount of referrals. We have to follow up those referrals. The Department of Health team that handles the call center. The call center is actually in our disaster management center. So I'll just quickly give you a background of how this works. Level 1 are the hospitals. That is if somebody has to go to hospital, and then a decision gets made by the supervising, what we call a command medic here, which is a medical doctor, as to whether the person, which of those levels the person must go to. Number 1 would be the hospital. Number 2 would be an intermediate care facility. So in other words, if the person is maybe released from hospital, does not require the kind of medical care that a hospital must provide, and the overflow kind of level, I'm sure you're all aware of the CTICC planning, that would be at level 2. Level 3 would be private quarantine, where a person can quarantine on their own accord and on their own account. Then we have level 4, which is private self-isolation, somebody that can isolate privately for their own account. Now, those 2 would mean not private in your own home. What it would mean is you would still make use of one of the quarantine and isolation facilities. However, you are able to pay for it yourself. And we actually do get quite a lot of that, specifically with businesses, etc., who bring people back from abroad and then have to have their people quarantined for a period of 14 days. The public isolation centers, level 5, is what we do probably the most work of. It is citizens that have been tested and require accommodation. And now, mostly of that, the isolation and the quarantine, the people are not able to afford to pay for that, and so then that cost gets carried in the Western Cape. And then finally is the household isolation and quarantine. Those are people that are able to stay at home and pay for themselves and look after themselves. And in some cases, we also get the situation where people are not able to look after themselves. So although they can isolate at home, they still have to be supported in terms of nutrition. Next slide, please. So these are just reports. This is what we call our Unity system. It's a daily report. It's as live as we get the details. This will just show you the report on affected persons. We have Unity is a disaster management information system, which we use for a wide range of issues. We would be quite happy to take you through the system when we have more time. But we just took a couple of screenshots to give an idea of what the things are that we work with. These are not up to date. They're just examples. Next slide, please. So this is the COVID-19 search engine. In other words, we can literally look for pretty much everything that is in there. All the reports, the contact people, the numbers of people, where they're located. It's all in the system. We're also using the system, obviously, to identify where our sites are, how they're being maintained, and we can, just to save time, etc. It has a search capability where we can actually go in and find whatever it is we're looking for in a short period of time. Next, please. So then the Provincial Disaster Relief Grant. We dealt with 2 grants. The first was, it was National Treasury that informed us to make an application. So a funding application was made for 53,338,667 Rand, was made to National Treasury via the National Disaster Management Center, and in respect of the Provincial Disaster Relief Grant, 53.2 million was approved. I'm not going to go through each single one there. I think you have the presentations, but those are for the health facilities, the numbers that you have on the bullets, and the amounts were for personal protective equipment, medical equipment, sanitizer and waste bags, and ventilators. And you can see the total cost there. Next slide, please. The next one was for municipalities. So we did a funding application of 239.3 million rand to the through the Department of Local Government to the National Treasury. It was reprioritized at the Department of Local Government. And again, unfortunately, the only approval we got was for 7.9 million. It was meant to augment municipal resources with regard to decontamination, PPE, hygiene packs, waste management, and sanitation. We're currently awaiting the allocation letters, but you can see on the bottom right there are the allocations that were eventually made. Next slide, please. So the current activities that we are busy with on a 24/7 basis is the health hotline. We receive in the region of 500 calls a day. Some of those calls are for feeding, understanding that this hotline is really around affected people, infected people, and people that are calling that might be infected. So those are extra calls that we receive. We receive a whole lot of queries, etc. Repatriation is the second area that we are still busy with. Up to today, we have repatriated in excess of 6,000 people back to their countries. What happened was that the airport did not allow people to gather there. So we set up a system whereby any charter aircraft that was going to leave the country, the people had to come to the Cape Town Stadium. There we processed them in terms of medical checks, in terms of immigration. And then once we had done all that, we moved them from the Cape Town Stadium immediately to the airport where they were able to get onto their flight and fly back to their countries of origin. We coordinate rapid response to emergencies. We receive quite a lot of reports from the districts, also from the public, around incidents where people might be intimidated, where we are having possible unrest situations. We have the SAPS in our center. The incidents are immediately transferred to the PROV JOC, which is the police's joint operations center, and then we coordinate that rapid response. We provide the logistical support. We have a logistics team who deal with whatever donations we get and whatever logistics support municipalities might have. That team then gets activated. It's a group of specialists with many years of logistics experience, and they support then those areas with their expertise. Then also the tracking and placement of persons under investigation and of high-risk persons, as I explained, into the various levels. We have the mapping system where all our health facilities, isolation, quarantine sites, feeding points, etc., are mapped and made available to the necessary role players. And then one of the areas that we are working with right now is to coordinate the preparation for a major escalation scenario. Thank you very much, HOD. Sorry, one last one is this just gives you an indication of what the dashboard looks like. It gets kept up to date every day, and it basically just gives us an indication. It's live in the center of what the situation is in terms of incidents, confirmed cases. Then we can drill down into every district, and we can then interrogate what the situation is in every part of the province. Thank you. I think that's the last one for me.
Thank you, Colin. I think it's echoing. Chairperson, members, if I may continue. So this department has also developed a communication protocol for local government. And this is the schematic illustration of the protocol. We have submitted this via the Minister to Cabinet. And so just how do we interact with the municipalities around the information in relation to COVID-19? So given the role that the Department of Local Government plays, we will either submit the information up north to the National Department of Cooperative Governance and Traditional Affairs, or otherwise we will disseminate the information to the metro and the district municipalities, and in turn they will disseminate the information to local municipalities. So on a political level, the Minister of Local Government communicates with the district mayors and obviously with the local mayors. And in turn, as a head of department, I communicate to the district MMs and the local MMs, and that's the flow. And that is in relation to some of the national and provincial circulars, the regulations, the various directions, stats, cases, general correspondence, and responses to FAQs in relation to COVID-19. This is just a narrative that supports that schematic illustration of the communication protocol. And obviously, as I already alluded, just to make a point here, and also given the discussions in Cabinet, the Premier takes responsibility to communicate with the leaders of the opposition parties and obviously keep the leaders of the opposition parties informed around the developments of COVID-19 in the province as well as in the various municipalities. Also, there is an approach in the province that when stats are released, what we do is we allow the mayors to get access to those stats before the information is actually released, particularly around the rate of infections in the particular districts where it occurs. So besides the Honourable Chairperson, besides the communication, there's also the information management in relation to COVID-19, particularly between ourselves and the municipalities. And the arrangement is within the province. If there is any request to any municipality in this province, it will be via the Department of Local Government. And that prevents that each and every department in the province communicates directly to the metro or the district or the local municipalities. And we facilitate that information, even if it's a request for whatever information, whether those are Q&I sites, whether that's around EPP and any information around the COVID-19, the Department of Local Government facilitates that information within the province. That is also just the word version of the schematic illustration, and also what we have, we also liaise with MISA, who's instrumental in the infrastructure projects around water and sanitation. And I'll speak in a moment about the ostensible 20 billion that's earmarked for local government in this regard, and how do we work together with SALGA and MISA. That's again just how we flow, the flow of information. We consolidate the information within the department, and if necessary, we submit it to the National Department of Cooperative Governance and Traditional Affairs, and they disseminate the information that are on the national level. So some of the work that the Department of Local Government has done, and we just followed as per your instruction, Honourable Chairperson, and I want to just ask Kimmel, who actually takes the lead on the national regulations, the directions, the work that we are doing around this, him together with his Chief Director, and I'll just ask him to present the 2 slides with your approval. Come on.
Thank you, HOD. Bringing on to the next. Honourable Chair, I'm just going to be covering the aspects of the regulations and the support that we provide.
Okay, please proceed.
That we provide to the municipalities in relation to the interpretations of the regulations. If we can move to the next slide. Thank you, Chair. With regard to the regulations, as you know, there's obviously there's been so many promulgations of the regulations and directions since the national state of disaster had been declared. I mean, the total calculations over and in excess of 120 sets of regulations and directions that have come out. In our case, we've got a dedicated legal team that will support the municipalities with regard to compliances, interpretations of the regulations. I think my HOD has alluded to the manner in which it reaches us, and then it's obviously also the communications through with the municipalities. So there is direct contact with the municipalities, with the legal advisors whenever they do require interpretations and directions. Generally, there's been compliance with the directions as well as the regulations. And the regulations, I must say, also attempts to practically deal with all the aspects. And when there is difficulty with regard to the practical side of it, we do also liaise with the national counterparts in relation thereto. Thank you, Chair. Next slide. Thus far, just an overall a list of the support that we've been providing to municipalities. Currently, I mean, as you would have gone through the regulations, they're quite detailed and extensive. So we've taken all the regulations and directions. We've actually produced 2 sets, which involves summaries of the regulations, which also then provides a link to the applicable regulation and direction. The purpose of the summaries is obviously just to make it easier so that if the municipality is looking or willing to identify an applicable direction or a regulation, it makes it more easily to access. In relation to the interpretations, just giving you an example, we've had several dozen requests on interpretations. One is just the movement of essential workers between towns, and we're talking about essential workers between various towns and the metropole as well. In the support part, I mean, we've been producing and distributing several circulars. This involves the recommendations relating to the involvement of councillors in COVID-19, the involvement of councillors in food distribution, involvement of councillors in NGOs, interpretations generally also dealing with the construction work and MIG projects. We've also promoted the fact that if anyone does breach or a councillor breaches the regulations, there should be, and the code of conduct for councillors as contained in the Municipal Systems Act still stands, and it must be upheld and must be enforced as well. Other issues that we've been dealing with is also the issuing of permits and the role of municipalities relating to that, Chair. Thank you.
Thank you, Timo. Chairperson, I'll just continue. So on a daily basis, we do some work around the municipal basic services. We on a daily basis and also reporting into the cabinet and its structures via the district model, and speaking to the districts and the city of Cape Town, we track the delivery of basic services in the municipalities, whether there's any interruptions in providing that. We've done together with the national department, also done an assessment of the frontline and essential workers, to what extent they are in place, particularly in municipalities, and are the municipalities be able to function with those minimum staff, and where the frontline staff are concerned, particularly at the desks, front desks, and also those, for example, with the waste removal, whether they have adequate protection in terms of PPE. We've done that. We've also given that through to the national department and also to the provincial treasury to begin to make an analysis as to what the extent of the stock levels are and what needs to be replenished. And just last week, the national treasury has also issued emergency procurement regulations with various service providers to provide all forms of PPE, where the national, provincial departments and municipalities can actually participate in. Just in terms of the improvement of basic water supply and high density informal settlements. So you know that the National Minister of Water and Sanitation and Human Settlements has made available water tanks and tankers various municipalities. I think the city has received close to 300-400 water tankers. The balance, the rural municipalities, if I may say so, has received about 400 tankers. And we have worked together with the Overberg Water Board and municipalities to see and use our own engineers how we can insist to construct the foundation for those water tankers, but also to connect them and ensure that there's water supply, particularly in the hotspots in the high risk areas. And we're almost at the stage where we complete that work, Chairperson. Just the following slide is this information has also been submitted to the National Department. It is where we encourage also the municipalities to sanitize municipal buildings and also public open spaces. And we see at regular intervals that we get reports from all the district municipalities where they've embarked on a approach to clean public places and municipal buildings, sanitizing them. We also know that in some areas they're using the fire trucks to sanitize buildings and streets in this regard, Chairperson. So we have, there is still the work that's been done around the shelters for homeless people are operational, and obviously municipalities were asked to assist in this regard, to gather all the homeless and to make provision for this. To a large extent, there is a service provider, Kirinox, that provide with the delivery of and the provision of food to these shelters. But some municipalities are also augmenting that food supply to the shelters and so on. And so there are a number of matters being discussed in relation to the shelters and the homeless, and what the way forward is in this regard. And on, I think, Saturday, for the whole duration of the morning and the afternoon, we have a MINMEC with the National Minister, and I think this is also on the agenda. The amount that Colin has spoken about, the criteria, the 168 million for which this department submitted a detailed submission to the National Disaster Management Centre, included funding for shelters for the homeless, to help fund those operational requirements. We out of an amount of 168 million, we've got a final allocation of 13.3 million, but with a final allocation, Chairperson, it was reduced to 7.9. I've personally written to the National Department to say, can we be provided with some kind of explanation as to why the amount has been significantly reduced. So part of that amount covers this provision for the shelters for the homeless. We don't know to what extent. We are, as Colin has indicated, also waiting for the allocation letters to get more detail around this. The screening, we are in contact with the Department of Local Government, with Health. That has commenced in various areas, particularly the hotspot areas. And so we are in contact with the municipalities where they raise the need for screening of certain areas. But there's also discussions underway to see to what extent we can fast track together with the Department of Health the availability of the test results as citizens in different municipal spaces are being tested. And I think the Premier and the Cabinet has also raised this with the National Minister of Health. Just in terms of the enforcement of the regulations, we are in regular contact with the Department of Community Safety and also all the municipalities via the districts to see to what extent there are compliance with the lockdown regulations. We still see that some of the younger generation are moving freely, but also that we require more assistance in relation to enforcement of the lockdown arrangements and so on. Obviously, there's regular feedback on the roadblocks in the different municipal areas, and the Department of Community Safety has generated an enabling environment for local municipalities and district municipalities to use some of the funding that they provided to the districts and to get some of the neighborhood watch members and to convert them into disaster management volunteers to help just with the queue management, the awareness raising, and also some of the just to help with the lockdown in terms of social distancing and so on. I think the City of Cape Town has done significant work around this. The Q&I sites, Colin has alluded to this. The Department of Transport and Public Works, together with ourselves, are in constant contact and engagements with the various municipalities. You would understand that the municipalities were required to identify all the Q&I sites in the areas, but there's now further discussions in relation to the operationalization of these Q&I sites in the various municipal areas. A concern at the moment is the financial sustainability of municipalities at the moment. We see, given the economic conditions, but also where people are not employed and not receiving a salary, that it is impacting on the cash flow and the revenue generating abilities of municipalities. People can't pay their bills. And in some cases, certain municipalities have taken initiative either for a payment holiday or reduced or put in arrangements in place to defer the payment of their bills. But it is problematic. It is a concern at the moment because on all the platforms, municipalities are raising concerns around their municipal financial sustainability and viability. And together with, at the direction of the Minister, we are now engaging the Provincial Treasury as well as the National Treasury and preparing certain documents to see how we can alleviate some of the financial pressures on municipalities. That was discussed in detail. This slide Colin has also made reference to. So there is now, we have approved the acquisition of a warehouse, and the logistic team that Colin has made reference to. We are now getting all the donations that we are receiving on behalf of government into the warehouse, and then with the discussions with various stakeholders like DSD and so on, particularly is it for humanitarian relief, we discuss where that food should be directed. But currently, this department is picking up the ball for that, and we're working with the other departments to see that we get the aid out to those that need it the most as a matter of urgency. Just in terms of humanitarian relief, I'm going to be brief. Cabinet has, the Department of Social Development has developed what we call a Plan 1 and Plan 2. The Plan 1 has been developed, and it was in relation to the 50,000 food parcels. I think there was significant pressure to ensure that people have adequate food, and therefore we also saw an increase in the protests around just the vulnerable communities in terms of food aid. As a result of that, and to fill the gap between the Plan 1 and Plan 2 of the Department of DSD, Cabinet approved that the Department of Local Government reprioritize an amount of 16.2 million, and that funding actually be distributed to municipalities to help the citizens that traditionally did not meet the means test for use by SASSA and DSD for their provision programs. So we have taken that money, Chairperson, and we have transferred the 16.2 million, except for the City of Cape Town. And I want to just put that slide on. This is how we distributed the 16.2 based on the approval of the Cabinet. And we've distributed that to all the municipalities. You can see for the districts, we've allocated 100,000 Rand, and I'll explain that in a moment. For the balance of the locals, we've given money based on predetermined criteria. So the allocations to municipalities was just firstly to track the relief initiatives, taking into account national nutritional guidelines, and the distribution of humanitarian leave to vulnerable citizens and communities, and work closely with other stakeholders to prevent duplication and adhere to other regulations and directions. So the funding was actually, and we have not prescribed whether that is, we left it open, and we have not prescribed whether it should be food parcels or whether it should be soup kitchens or whether it should be a voucher system and so on. But the important factor for us was that those that are vulnerable actually are provided with food. The district municipalities has got each 100,000, and we also want to build a database and get data as to how the province is supporting citizens in this regard. And for that reason, Chairperson, we have, this is just a dashboard. We have developed a dashboard to track the funding of the 16.2 million, how it's been applied in a municipality. And as I indicated at the beginning, we would like to give you a live presentation of this app, and we'll take a minute or two. But we are tracking how the 16.2 million in this province is being used and applied for the citizens in the various districts. And this information is disaggregated to ward level, Chairperson. So the next slide is this illustration, what has happened with the food. I think we could have filled the entire presentation with photos where food parcels have been generated through the funding that we've given, and the community members got involved. Chairperson, I just want to add here, the municipalities have actually made significant contributions from their own budgets. What we have done is we've augmented as the provision of humanitarian leave. There was a question around the sustainability for municipalities and so on. So the provincial government had to step in and see how we could assist. What we've also done is that we've approached Agri-Western Cape, and Agri-Western Cape has approached various farmers, the farming community, and they are now giving, Chairperson, tons and tons and tons of fruit and vegetables, and that is also being distributed to the various municipalities and the communities. Part of that will also go into the warehouse. This is another area where the department has done significant work, and as we call the fatalities management, and we're in the process of finalizing the work around this to take it to cabinet in the next week, and then most probably for public comment and consultation. I'm going to ask either Chairperson with your acquiescence just to take us quickly through this presentation. Thank you very much.
Thank you, HOD. Chairperson. Just to indicate to the committee that we have established a working group that is dedicated towards looking at the fatality management planning for the district as a whole. That would include the city as well as all the municipalities in the more rural areas. So the first task at hand for us was to establish a working group, which we've done. And just to note, the Department of Local Government, we drive the process. We're very closely supported by my minister's other department, Environmental Affairs and Development Planning, as well as Health. That's a key partner. And I think importantly also to mention that the City of Cape Town is part of our process, as well as all the district municipalities are represented. And lastly, we have managed to secure the support involvement of Home Affairs. As members can imagine, they play a critical part in the entire fatality management process. What we've also done is, for all the documents that we are preparing, these are legally vetted by a team that we've created that support us, and also supported by our legal team from the Department of the Premier. I have indicated that Home Affairs is on board, which means that they have already undertaken to us that they will increase their own capacity in line with fatalities increasing in specific areas. They also have mobile facilities that will make us available to us for this purpose, and that members is specifically to certify deaths and also deal with death certificates that needs to be issued quite quickly. What we then also have to do is we collect additional information from municipalities that assist us in our planning processes. Just an example is, what space and capacity do you have available as a municipality in your cemeteries? And also, do you have undertakers? How many undertakers do you have? Are they registered, and can they support you if the numbers start getting higher? Then just to indicate, the last two bullets on the slide indicates a number of matters that we are currently engaging the National Department of Health. Understandably, there are a few matters that's currently not provided for in legislation or the regulations, and we've alerted the Department of Health, and we're currently engaging them for further clarity on this matter. Then just in terms of our next steps or the documents that we're currently busy with, from a provincial planning point of view, there is now a provincial guide that is available that must guide and assist specifically the management of COVID-19 fatalities. This is on a high level, a step-by-step guide to indicate the steps that you need to follow, which documents needs to be completed and which stakeholders needs to be called. The second one is a document where we are assisting district municipalities and the city to indicate when does your mass fatality plan need to kick in. The next one, which is our big deliverable that the HOD just spoke about, that is the protocol for funerals. We're currently in a final consultation phase for that document. The next document that we want to be able to do, and have already started with members, is a MOU for funeral undertakers to bring them on board and in line with the documents that we are adopting in the province. And then the last one is we are frequently now getting questions not only from municipalities but undertakers and also the religious fraternity asking us for questions, and we are providing feedback on a constant basis to them. Members, that was the planning that we're doing in the province. Over and above the planning that we're doing in the province, we're also currently assisting municipalities because these fatalities will take place in their physical areas. So the documents that we've done to date is the mass fatality plans. Every single district has now a plan and has adopted it accordingly. We have copies of those. The city is currently, they've also developed their own plan, which obviously is a little bit more detailed and also slightly more intrigued than the ones for the districts. They are currently undergoing the final internal consultation processes, and that document should be coming to us within the next day. Importantly, and also the last bullet, members, is just to indicate that all the districts and also the city have now established mass fatality command centers that will not be activated until the point that that becomes necessary, but the people have been identified and the communication have gone out to confirm that all these people are ready and in place. Thank you, Chairperson HOD.
Thank you, Chairperson, with your Nabil just to give us a live demonstration, but while he brings up his screen, may I just add to say that this department has also provided about 30,000 bars of soap to the various municipalities, to the districts, and they were responsible of further distributing those soaps. And that was just how to help with the hygiene factor, people washing their hands to improve the hygiene and prevent the further spread of the virus. Thank you, Chairperson. Nabil.
Thank you, HOD. Good afternoon, Chairperson and members. Just in terms of the application that was developed, as well as the dashboard, the department in collaboration with CEI has developed humanitarian capturing applications for each local municipality within the province. Okay. This was developed primarily to monitor the local government support grant. I will go into one of them. I will choose Berg River. Okay. It's a very simple and intuitive app. Just in terms of the way the layout and in terms of the requirements. So this is Berg River Municipality's humanitarian relief app. So just in terms of how we go about capturing it, you can basically choose a town. So I'm going to choose Indekale in this case. The ward numbers automatically pick up. You can choose the ward number. The funding source, we've made provision for the local government support grant, Department of Social Development, municipality funding, SASSA funding, NGO funding, as well as donor funding. I'm going to choose local government funding. And then just in terms of the implementing agent is the entity that actually does the delivery. So in most cases, when it comes to our local government's grant, it will be the municipality. And then in terms of the type of aid, we've kept it simple. We've just indicated either a food hamper or a hot meal. The next one that needs to be populated will be the number of households or beneficiaries. Here we will just enter, as an example, 100 food hampers. And then in terms of the date, we can either capture retrospectively or the current date. So I will choose the 4th of May as the date that this was captured on, and then I will basically send it, right? It goes in real time. This information gets captured and sent into the cloud and into the Western Cape government ICT environment where it's stored, okay? I'm not going to submit this as this is a live system and I don't want to create any problems with this. However, just in terms of where this information gets stored and visualized, I will just have to unshare my screen and then go to the next screen again. So this is the dashboard where this information actually gets visualized, okay? This dashboard gets updated in real time. So as municipalities capture, the data gets pushed through. We've set it as on a refresh rate of about every hour. So every hour the information in the dashboard gets updated. What we are currently tracking, to date, 9 municipalities have provided information, but to our knowledge, many municipalities are currently in the process of capturing their information. As you can see, 9 municipalities with 30,352 parcels, as well as 64,000 meals have been provided. 68 wards have been covered, and approximately 39 towns have received parcels. Just in terms of the city at this point in time is not included in this particular dashboard. Just in terms of what we are able to view and what we can query, we can basically see at this point in time which municipalities have captured information and how much food parcels have been provided. You can see in the Berg River municipality, they've distributed about 8,379 food parcels. We can also see which wards the information has been provided, as well as the towns and who the funding streams were that provided these parcels. I will just do a query and say, okay, if we want to see what's going on in the Berg River municipality, we can actually see within the municipality which wards have been covered, as well as the towns. Within the Berg River municipality, we can see in Porterville they've distributed 1,600 food parcels, as well as who funded these. So at this point in time, the funding primarily has come from the local government support grant, as well as the municipality's own funding, and some funding from donor organizations. They've also been handing out meals, hot meals. So to date, they've provided 49,847 hot meals. Okay, this we can aggregate up to a district level as well. And every district municipality has access to this dashboard. The reason for that is so that they're in a position to monitor and also to highlight gaps, where certain issues are not being dealt with. Thank you, Chair. That's all from my side.
Thank you, Chair. As indicated, the city is not in this. There are discussions with the City of Cape Town. They've requested that we tweak this app for their specific purposes. And we are in contact with the City of Cape Town, but also Andrew Barain, who interacts with the NPOs in the city. And given the governance requirements in the city around data management, we would make this app available to the NPOs and the NGOs for the city, tweak it for the city, but also for the NPOs in other parts of the municipalities where they can actually physically capture it. This information is all centrally fed back to a nerve center in the Provincial Department of the Premier Chairperson. Chairperson, I would like to conclude with that. Thank you very much. And as Colin has indicated, at the next time, we can also do a live presentation on the Unity system in the Disaster Management Center. Thank you very much.
Thank you very much, HOD and Minister, and to all the officials for having prepared that information. Some very interesting information that came out of those presentations. I'm now going to open for questions in our usual manner. If members have questions, please feel free to pose on all the briefings that we've received today. As usual, I will allow 3 minutes per party, starting with the DA. Are there any questions from the DA?
Yes, Chairperson, we have questions. I have. Chairperson, thank you for the opportunity to pose the following few questions. But may I ask, will we have a second round of questions, or shall I complete all my questions now?
Well, we'll utilise your 3 minutes, and hopefully there will be time permitting to have a second round of questions on these presentations.
Thank you, Chair.
Okay.
Firstly, Chair, I'd like to commend the Minister for his swift action, which was fairly unambiguous when it came to the fore, or when he heard that councillors were involving themselves in the distribution of food relief measures. But Madam Chair, in our first meeting of this ad hoc committee, Honourable Heron and Honourable Christians brought allegations of councillors involving themselves in the distribution of food parcels on a party political basis to this committee. I'd like to ask whether the Minister's office or the HOD's office received any details and specific complaints with regard to councillors who have involved themselves in party political actions with regard to the distribution of food aid. Whether those allegations, if they were brought to his attention, whether those allegations were investigated, and what were the outcomes of such investigations. Secondly, Chair, with regard to the humanitarian aid and this over 16 million rand that was distributed to municipalities, I recognize that there was a demonstration of the dashboard in terms of the distribution of the aid in the various municipalities. But what for me is missing, and I also take it that the HOD was saying that they weren't prescriptive in terms of the criteria that were laid down in terms of how that aid should be used. The dashboard doesn't provide a verification mechanism whether that, what it's supposed to say hadn't actually happened, because the municipalities will upload 1,000 food parcels, but how do we know whether those food parcels were actually distributed and reached the intended beneficiaries? Thirdly, Madam Chair, is that it was stated earlier that the department applied to the National Treasury for financial aid to the tune of 239 billion rand, and then it was reduced to 160 say 9 billion rand for various sanitization and PPEs, etc. Ultimately, it was then just allocated 7.9 million rand. Now, either way, Chair, is that it's simply just 3.9 million rand, 3.3% or 4.8% that was allocated in terms of what was required. So the question that I would like to ask...
Please wrap up, thank you.
Well, Chair, gosh. The question I'd like to ask is that the HOD was saying that he did write to National Treasury for any explanation and is still waiting on the outcome. Now, if one compares the amount applied for and the amount allocated, there's a huge deficit, and who's going to finance that deficit? So, Chair, I have many more questions, but for the interest of time, I hope you will give an opportunity to ask a second round questions.
Thank you.
I will stop there. Thank you.
Thank you, Honourable America. The ANC.
Thank you, Chair.
Honourable Dugmore, please proceed.
Yeah. Thank you very much, and also thank you to the MEC and the officials for all the presentations. Chair, I would first like to ask, in regard to the various work streams which have been referred to that sit under the Cabinet, could I ask whether any of the work streams have actually produced a strategy and an implementation plan? And if they have produced such a plan, if we could be provided with that by the officials, and if they have not produced a strategy plan for that particular work stream or cluster, could we have an explanation as to why they haven't? Then secondly, it's interesting to note that in this presentation, there's now reference to provincial and district command, whereas earlier on, when the lockdown began, there was no such mention. Because our view, and I would like the MEC and the HOD to respond to this, is that one of the critical reasons we are failing at so many levels in the Western Cape in our ability to deal with the pandemic is the fact that we don't actually have a command. We have a cabinet. We've now been informed again that we have HODs, we have the PTM, but a command is a command. And what we have at the moment is an absence of a command in terms of that structure and at the district level, where similarly, we've also heard a report on the JOC. And I just want to ask, is the understanding of the MEC and the HOD that a JOC is a command? I would like to establish that. And then also the presenter on the JOC indicated that they operate 24/7. I would like to ask, how does that actually happen, that the JOC operates on a 24/7? Is there a particular line that is available? Who is allowed to call that line? Is there someone physically, a team on shifts that is physically there for 24 hours? And how does one, as a public representative, communicate directly into the JOC? Then I would also like to ask that dashboard that has been provided, does that also indicate the actual the voting district which falls under the ward and the actual participants who've received food parcels, in other words, their ID numbers? I would like to ask whether that actually is the case. And specifically in regard to tracking, it's one thing to track certain issues, but for instance, can we get a direct response to the question of the 50,000 food parcels promised by social development? Where can we have a breakdown in this meeting of where those 50,000 food parcels have gone and how long it took for the first food parcel to arrive? I know I've run out of time now. Thank you. We'll come back in the second round.
Thank you, Honourable Dugmore. EFF. I don't think we have any representatives from the EFF in the meeting. Good.
Thank you, Chairperson. If I may start with a high-level question that I don't think was covered in the presentation. It may have been, but I lost signal for a while. There's been some talk from both the President and the commentariat, for want of a better description, of in this risk-adjusted strategy, moving to a kind of more localized differentiation between the phasing out of lockdown. And I'm just wondering if the department has had any engagements with the national minister around the implementation of a differentiated approach based on infections, etc., in local areas, and what planning has been being done to move to that kind of implementation of this risk-adjusted strategy. I hope my question was clear. If I can go to there was a slide about the different clusters and some of the work, and then we got some detail on the health clusters work. And I mean, given the infection rates that we're seeing in the Western Cape and the deaths, the idea of an individual who's infected, tested positive, being given the opportunity to self-isolate based on their financial resources, is that the best approach in terms of containing the transmission of this virus? And are we looking at whether there should be a mandatory isolation in a municipal or provincially provided facility? And then a question around the funding. The 53 million is the same amount that the province is allocated for social relief. And I'm just wondering if that is a coincidence, or if it is a funding, if the funding that was then provided to the health department was moved from the health department. In other words, there's 53 million was allocated for food and other social relief, but it's also the amount that the provincial treasury applied for from national treasury in terms of the disaster act. So is it the same amount, or is that just a coincidence? And then finally, the question around councillors' involvement in COVID-19 and food parcels and NGOs. There was reference made to circulars being sent out, and I would appreciate it if we can get some more detail around what you mean by circulars and how are these being complied with or being made mandatory. Thanks so much, Chair.
Thank you, Honourable Heron. Any questions from the ACDP?
Thank you very much, Chairperson. The questions is...
Sorry, could I just ask Honourable Douglas to turn off his camera?
Sorry.
Thank you.
Sorry,
thank
please
you,
proceed
Chair.
on your question.
Thank you, Chair. Just a couple of questions. I saw the risk assessment, and of course, when I looked at the risk assessment, I was immediately worried about the informal settlement exposure. We all know that is a problem, and how is disaster management coping with that? And also now with the winter season coming in, people living in informal settlement, it's extremely difficult to stay indoors, thinking about the small area that they stay in. So did they, that risk assessment, was there any plan of action how to combat, the further spread of infections when it comes to the informal settlement? Another question maybe also is the municipal officials, those who are doing essential services, those going out, are they all furnished with PPE? Is that provided by municipalities for workers in municipalities? Also the water tanks. I think this is the HOD that mentioned the water tanks that has been distributed, 400 or something in the city, and then also district another 400. Can they tell us that we had complaints that there were people that water was cut or that's on the dripping system, and it's very, very difficult to wash your hands when it comes to these problems that people don't even have, they've got a dripping system. Was there certain complaints and what was done about that? And also maybe did it come to the department's attention? And I'm just talking about Metro Police and law enforcement, the hard-handedness of law enforcement officers and city police when they attend to problems and people adhering to the regulations, complaints of hard-handedness, and how are they trying, because the role of the department is also, like they said, helping with interpretation of these regulations. And law enforcement officers, sometimes they do not understand the regulation themselves, and yet enforcing it. We saw a lot on social media. So I just want to know Did the department also, are they busy looking at that and sending out circulars to help municipalities so that law enforcement officers do their job, but that they also don't manhandle those individuals? Now the question is, municipalities also now with their officers, I've spoken to people, and their offices where people usually go pay their cash is closed, so they must use of alternative ways of paying their normal bills where they usually go to municipal buildings, and that facility is not there. So it's also there's also creating extra problems now, and maybe municipalities will have to do more educating people and say where people can they still pay the cash and still goes to the municipal offices. That's my round now. Thank you, Chair.
Thank you, Honourable Christians. The Freedom Front Plus.
Thank you and good morning, colleagues. I listened with very much interest in what was said, but I've got a few questions which I would like to be clear. We heard of all the people that's active and all the people that's involved, but it still doesn't explain why, in spite of all this, we are leading the whole country with infection 6,105, Western Cape, Gauteng only 2,014, Eastern Cape 1,504. What is the efficacy of these lots of bodies and people that's involved? I read the Act, Section 29, Disaster Management Act. It says there that the MEC responsible for disaster management must appoint the head for this disaster management forum. I would like to know who's the head. Did he appoint himself, or who is the head? It also says that this disaster management forum or center, he may appoint people from labor, organized agriculture, traditional leaders, religious and welfare communities, and also other relevant and religious and welfare organizations. I didn't hear any of these groups were involved as advisors. It's an advisory forum supposed to be. I know my colleague Cameron Dugmore spoke of a command, and he's right to say so, because that is what the department also said. It's a command, but the Act doesn't even mention the word command, although there is a command center now in place. It talks more of a management advisory forum. So maybe they can explain to me how they got from advisory forum to a command center. The one is advisory, the other one is far more than just advisory. Number one to be answered. And then, of course, I would like to explain to me why is it that in the Western Cape, in our prisons, so few prisoners is infected. I got the figures here. Most of the infection is actually wardens. But we want to protect the prisoners. And is there any protection for the wardens? Because the way I read it, and the stats that's been given last night, positive cases, officials 81, inmates only 10. 10 inmates infected with COVID, but 81 officials of correctional services. Who are we protecting here? I'd like a department to answer me. Is my 3 minutes finished?
It is, so.
Wow, that was the shortest. Okay, fine, thank you.
Thank you. All right, thanks members for your questions. Minister, I'm going to hand over to you and your department to answer those questions. Thank you very much.
Thank you, Chairperson. Just very briefly from my side, we must just not mix up the billions and the millions. There's a difference. I do get the question of Member Mika that we haven't received our fair share, and it's an ongoing fight, and we've put it in writing to National. Remember, there will also be other allocations, so let's hope that we will make that one up. The But I think what I'm going to do is let me get the HOD to run through the answers. I think it will be quicker, and then I will pick up if there's anything that we left out. HOD.
Thank you, Minister Chang. Thank you, Chairperson. I'm also going to rotate the responses, but let me then start. I think just on the first question around the council distribution of food parcels. So we have developed a protocol in this regard, and we can make that protocol available. We've submitted that protocol to the Cabinet, and Cabinet has endorsed it. We've taken that protocol that prevents councillor to participate in the distribution of food parcels, convert it into a circular and attach both the protocol and the circular and issue that to all the speakers and all the mayors in the province to make sure that there should not be involvement of the councillors in the distribution of food parcels. We have not received any formal complaints about political distribution or otherwise councillors in the distribution of food parcels, not in writing, either to myself and to the minister, and therefore we have not investigated any of these cases in the event that there were cases. What we've also done in addition to that, Chairperson, with our meeting between ourselves and the DG and the municipal managers, that was also a point of discussion, and we've raised awareness amongst the municipal managers and asked for the municipal managers if there's any councillor that is involved in the distribution of food parcels, they must actually bring it to the attention of the speaker, and the speaker in turn must bring it to the attention of the MEC in the province and get the detail around it so that we can deal with if there is any. Obviously, it must be subjected to the regulations, to what extent the regulations has been transgressed, but also about if in the event that it has been raised to the speaker must comply with the normal code of conduct in relation to councillors, section 14 of the code, and they must deal with it to then establish what we call a disciplinary committee, and that should take its normal processes. So we've detailed the entire protocol and the process steps in a protocol, as I said, submitted to Cabinet and then endorsed and distributed to the various municipalities within the province. Just on the humanitarian aid, how do we make sure that the food is actually distributed? Chairperson, it's part of the grant conditions, it's gazetted, but over and above the grant conditions and the allocation letter, there is a MOA with each of the municipalities between myself, this department representing the department, and the municipality, and that is detailed, and it's a requirement that the municipalities must report the data on the distribution of the food parcels, and that must be consolidated and submitted to us so that we can monitor and track. It's further strengthened, Chairperson, by the app that they have developed and make it easier so it's real time on it. Just in relation to the 239 million instead of billion and the 168 million. About 3 weeks ago, we were in a technical MINMEC, Chairperson, and it appears that in certain cases there were grants made available. There were some grants to which this province were not privy to, and so the provinces like KwaZulu-Natal and Gauteng have benefited from some, and all the other provinces, including this province, has raised concern that why we're not privy to certain grants. But over and above that, we've also raised concern around the application that we've made, all the effort that we put in, and we followed strictly the criteria into what was presented to us. And at the end of the day, we get a 7.9 million of 168 million. So part of the response that we received, Chairperson, is that in the initial application, they said the application makes provision for water and sanitation. And obviously water and sanitation, sanitizing of public places, and it's for PPE and for shelters. So when we discussed it in the technical Banmek, the National DG, acting DG indicated, and the CEO of MISA, that the water and sanitation part was removed out of it without further consultation with the provinces, and all the provinces, including Salga. The CEO of Salga has raised concern about the way that the national government or the National Department of Corporate Affairs and Development Planning of Traditional Affairs actually go about in terms of its transparency in allocating the funding to provinces. So over and above that, you would remember that the President has indicated that 20 billion to local government. We were in contact with the National Department, and they've indicated it's fundamentally for water and sanitation infrastructure projects to help curbing the spread of the coronavirus. And so there is still clarity being sought from the National Treasury around the grant conditions, and there's interactions between the two departments up north. But we have begun between ourselves, municipalities, and the Department of Human Settlements to gather the information around the projects that relates to water and sanitation in relation to each of the municipalities, Chairperson. Just in terms of the work streams, Honourable Chairperson, the work streams have presented work in relation to their portfolios. I can just mention, so for instance, the Humanitarian Relief work stream has presented, they have done significant work around their strategy. There was first the initial plan, the process plan and a strategy, and then there was a second strategy, and I think some of that is now overtaken also with the interaction with SASSA in terms of the provision of a grant for the unemployed and the food voucher. So that's one example. The other example was around the work of the infrastructure unit, where they've actually done work around the Q&I sites. They provided strategies and documents with the local municipalities, but also in the process with that of the city of Cape Town. Just the finance and the administration, they've done extensive work on the package for COVID-19 in terms of how do we fund some of the COVID-19 expenditure, and that has also gone to the Budget Policy Committee. And over and above that, Chairperson, that finance and administrative group has also done work around the administration. In other words, how do we deal with the staff in the province? How do we allow them to come back? And in line with the circulars of DPSA and so on, what is our strategic approach to bring some of the staff members back in a phased approach? So they've done extensive work, and there's extensive policy documents around that. I want to make one or two other examples. Also, I was just thinking of all the work streams. The communication has also done extensive work around the approach of communication. They're doing research as to say how the people of the province prefer their communication, what is the strategy, and we get on a weekly basis, Chairperson, updates around this. But the most important is the work that the health sector has done, or the cluster has done in this regard, because all the other work that the other sectors are doing is based on the modeling and the strategy that the health department has developed. So given the updates around the modeling of health, you would know initially that based on the modeling, the peak was scheduled for somewhere in September. That was revised to August, and now we see that the peak most probably in this province is around June, and they've adapted their strategy to take that into account and so on. And obviously, in line with that, the Department of Transport and Public Works are now making provision for extra facilities in Q&I sites, but also field hospitals in relation to the centre of Cape Town, just here down on the foreshore, to convert that into an 800 bed facility. So extensive work has been done around that. But what has happened now, Chairperson? We have now, just over the last week, identified the hotspots. So Witzenberg is a hotspot, and the Cape Winelands, and that will be extended to Drakensberg and Breda Valley, but also areas like in the Noon, Khayelitsha, and so on. So the entire government is coming together to develop an integrated response plan for each of the hotspots. And certain HODs, together with the Health Department, the Department of Local Government, with the relevant municipality, in this case the City of Cape Town, are taking the lead on an integrated response to that hotspots. And we've just taken a presentation, Chairperson, this morning on the hotspot of the Noon and how, as a whole of government approach, do we actually contribute in relation to our own portfolios to curb the further spread of the virus in the Noon, for example. So, Chairperson, the JOC is a form of a command center, but that is on an operational level. You get the command center that's on a political level. Then you get the command council is on a political level. The command center is on the administrative level. And the command structure in terms of the JOC is on the operations or on an operational level. And so they feed into one another to get a better picture of what is happening with the virus and how do we manage it and to what extent are we successful. I'm going to allow Colin to respond to the question around the operation of the JOC. It is a 24/7, and as the Honourable Member Dagmar has indicated, there are shifts, but I'm going to allow just Colin to give more detail around it. So the risk-adjusted strategy, the phasing out of lockdown, Honourable Heron has raised a question. So there is, for example, Honourable Chair, the Central Karoo, Dr. Rabe has raised the request with myself, the Minister, and Cabinet to ask to what extent Central Karoo, the economy can be open, and that can be actually a level 1. We have presented that request to the Cabinet, and it has been once again discussed this morning, and that was supported by further representation from the Mayor as to why that should be open. In my understanding, we as a province can make representation on behalf of those areas, and we know at this stage there's no infections in Central Karoo. So the Department of the Premier, by means of its legal services, are looking into this, and with a view of writing to the President and to the National Minister of Cooperative Affairs and Cooperative Governance and Traditional Affairs, and to petition the need for that to be open. But that authority does not sit with the province; it sits with the national government, and including the province. The President. There are also discussions in Cabinet with a view to reduce the levels in terms of the risk-adjusted strategy to get some areas to a level 3 and some levels to a 2. But there's also the risk where you find that there are hotspots in the province, and the risk, not the risk necessarily, but the view that could be escalated to a level 5 for further lockdown and so on. But there are initiatives in means of this integrated approach in terms of the hotspots that we are doing in that. I'm also going to ask Colin to respond to this self-isolation containing the mandatory, and then Chairperson, the 53 million that we've requested right at the beginning. The National Department of Cooperative Governance and Traditional Affairs asked us to make a bid on behalf of health. They had funding available with the National Disaster Management Center, and what we've done is we were the first province that actually submitted that, and based on our submission and motivation, we got it money for particularly the health purposes. So other provinces followed suit. We got the lion's share of it, the 53 million, and it's not the 53 million received from the National Disaster Management Center has no relation to the money that's provided through a Section 25 notice by the Provincial Executive or the Cabinet for humanitarian relief in relation to social development. as well as the feeding schemes of the education department. I've made reference, Chairperson, to the councillors, the involvement. There is a protocol, and we can make that available. Just a question around informal settlements, the risk assessment. I'm also going to ask Colin to speak to that. But you can see that some of the hotspots in relation to COVID-19 are particularly the informal settlements, like places like Khayelitsha and Dunoon in this regard. We've done an assessment, the frontline staff around the PPE, and as part of our reporting into the cabinet, we make a weekly assessment on the levels of PPE for frontline staff, and our arrangement with the municipalities is, in the event that there is a concern, they must raise it with us. We've also raised that with cabinet, and there are mechanisms in place, but obviously there's a short supply. But given the regulations that came out now from the Department of, or the National Treasury, with the service providers, one can actually procure from that approved list. The water tankers, Chairperson, that has been made available. And just in the city got 214, just a correction, and the non-metro municipalities got 401. And the Overberg Water Board was responsible to install this, but I think the capacity is limited, and that's why we are now working together with the Water Board, with the municipality and the Department of Human Settlements in the province to help to install those water tankers faster and to get actually water into those water tanks so that people can have access to water, particularly in densified areas and so on. Around the water cuts, there was particular relation to that in the city of Cape Town. When the lockdown started, the city of Cape Town, according to our knowledge, on inquiry, has suspended the restrictions, and they have allowed people, notwithstanding the increased debt that they have, access of water, and they've applied same principles in terms of the amount of water to residents, particularly free basic water. And if they have consumed the water for an entire day, the next ration of water will go onto a drip system, but the next water will kick in and so on. So the city of Cape Town has suspended all the water cuts and all the credit policy, control policy measures in relation to water. And UCO from the city of Cape Town provides us regular feedback around the application of the credit control policy in relation to water, Chairperson. We've spoken about the law enforcement and the heavy-handedness around the law enforcement. I think generally municipalities are discussing extensively the social distancing, and we know it is a challenge because we get feedback from the municipalities, and this is a conversation that we have on a daily basis to strengthen the law enforcement capacity. And that's why I've said that the Department of Community Safety has made funding available to take some of the neighborhood watches and turn them into disaster management volunteers. But the police sits in on the extended cabinet meeting on the daily basis, and they report back, and we give them feedback, because as the local police captains, station commanders in the different local municipalities and the districts also sit in on their JOCs, whether it's a local JOC or the district JOC, and on the provincial JOC, the police also sits in, and if there's any kind of complaint, we then take it up with the police, but we also would take it up with Brigadier Zandberg in the extended cabinet meeting. So there is also limited capacity in terms of the police to comply or to enforce the regulations, particularly the social distancing, and that's why we're working together with the police to strengthen the capacity to ensure that there's adequate enforcement of the regulations. We also understand that a number of police officers were infected with the virus, and is in quarantine, but also that some of the police stations have also closed and disinfected and subsequently reopened. So just on the revenue officers, when we reduced to level 4 chairperson, the National Minister, Minister Shlamini Zuma, has issued directions in relation to municipal matters, and part of that directions was that municipalities can now have, for instance, virtual meetings, council meetings. That was prohibited until the 30th of April, but municipalities can also now open their revenue offices, their cash offices, where people can come physically, come pay, and obviously with great awareness of social distancing and the proper hygiene. But given that directions, all the municipal cash offices where people can pay their bills and their accounts are now open. Chairperson, just on the question about the command center and the head of the disaster management center. So Colin Diner is the head of the disaster management center, and the advisory forum is prescribed by the Disaster Management Act. And that's the structure that the MEC responsible for local government must have in the province. But the national government has established the structure, which is the Command Council and the Command Center and the JOC. And the structure that has been established by the national department is not necessarily in line with the prescriptions of the Disaster Management Act. But that is what the national president has indicated we should respond in the structures, and we are complying with that structures, although the Disaster Management Act prescribes something different, Chairperson. And that's also to do that the minister has in this advisory council. Just in terms of the prisoners, we monitor the detail via, the Department of Health takes responsibility for the monitoring of the data, but as the complaints, Chairperson, comes through from the various municipalities, for instance, on Monday we had a complaint around the prison in Portable, where you find that the wardens are actually infected, but they move freely amongst the community members in the shops and that kind of stuff. So we've also raised it, and with the police and the Department of Health, and they are attending to it. We know there are infections in the province, and we also understand through the Department of Community Safety that the Correctional Services Department is considering releasing 19,000 parolees from the prisons. Chairperson, I'm just going to ask Colin just to respond to the isolation and then also to the shift working in the center. And then Morna, I'm not sure whether you're online, that you just come in on the IDs of the citizens receiving the food parcel. Thank you, Chairperson.
Thank you, Chair. Thank you, HOD. So just in terms of the 24/7 disaster management centers, what we did was we realized that we do have that there will be a lot of rapid events happening, that things will be happening very quickly, and that we have to respond quite rapidly. So it was never the intention of the disaster center to take over the actual call centers of emergency services, but what we have done is we have five members per shift of provincial disaster management within the center at all times. We have an email address that they receive emails. It's not a public center, so the messages we get could be from SAPS, it could be from district disaster management centers, it could be from ministers, etc., where they provide us with information or something is reported to us. If it is something that needs the attention of any of the other agencies, we then relay that message. We have a member of the South African Police Services within the center at all times. That person is the link between ourselves and the Provincial Joint Operations Center of SAPS. So if any messages need to be sent or any got
there were follow-up questions, but I'd invite you to please submit them in writing, and we will get the answers from the department in writing. Without any
point of order, Peter Marie.
Okay. Honourable Marais.
I would like to. I thought the minister was going to respond to me why he has the power. He did not involve all the communities, labour unions, religious organisations in his advisory council, whatever he calls it. I would like to know why he decided to exclude them. Why did you exclude traditional leaders, the agricultural sector, the labour union?
So your question wasn't answered, is that the point of order?
Answered.
Okay, I'll ask the minister. Honourable Dugmore.
Thank you, Chair. Chair, I think we are beginning to have a fundamental problem about the order of these meetings, because we literally have so many questions to ask. We are not getting full responses to the initial questions we've asked. We were promised a second round of 3 minutes. My other colleagues from the ANC are waiting to ask questions. And in a way, I think I want us to discuss whether we should not disband this ad hoc committee and rather have the different portfolios actually meeting, because then we'd have more time to ask questions. Because at the moment, if this committee, no, I'm not finished. If this committee was set up to actually have oversight of ad hoc, it is actually failing because it is providing information but not allowing us to conduct oversight. That's my point of order.
Okay, Honourable Dugmore, each party has been given an opportunity to pose questions. That has not concluded. We continue to do that today. Also, members have the opportunity to pose questions in writing, etc., etc. And we have a particular mandate given to us by the Speaker. However, I am trying to manage the time as best as I can. But if there are burning questions then, and it will mean that we will have less time to pose questions then to the Environmental Affairs Department, but we'll see how we go. I'll then give 1 minute to each party. Let's start with the DA.
Order, Chair. Order, Chair.
Honourable Lek, is that a point of order?
Yes, Chairperson.
What is your point of order?
Chairperson, part of the process that I wish to advise, because we've got so much work to do and we've got an oversight responsibility, I would like to make a proposal that the other presentation, we find time for it, because this first presentation is enormous and we really need to drill down to it so that we do proper oversight. So I would like to propose that we do the next presentation some other time, or we find a slot for it during the course of the week. Thank you, Chair.
Okay, right, let's see how we go. DA, over to you. Please pose your questions.
Thank you, Chair. Chair, it was stated in the presentation that Department of Water and Sanitation provide water tanks infrastructure to various municipalities. So the question that I'm asking in relation to that is that who bears the operational costs for the installation of those water tanks, and also the ongoing costs associated with the provision of water from those tanks? Secondly, we are finding ourselves in an environment where municipalities will be dealing with the IDPs and the budgets, etc. And with the restrictions imposed on gatherings, how are we going to manage that process to make sure that there's adequate participation with regard to the conclusion of that particular process? Thirdly, municipalities, the environment imposed on municipalities to follow different protocols with regard to sanitation, PPEs, and various other mitigating measures to retard the spread of the virus. Needless to say that these new normal that we find ourselves in, it will have financial implications for municipalities, and many of our municipalities are not by the means to finance these demands. And we're finding ourselves in challenging economic circumstances where people find it difficult to meet their financial obligations. What assistance are we going to provide municipalities to comply on an ongoing basis with these new sort of protocols? And then lastly, Chair, we as South Africans are being asked to make extraordinary sacrifices to mitigate the full impact of this particular virus. And at this stage,
a very long minute.
Due to the fact that we're still in a lockdown, we haven't really felt the economic impact of the lockdown and the consequent loss of employment opportunities for many of our people. Now, municipalities are going to draw up the budgets, they're going to decide on tariffs and increases, and maybe to what extent can the department influence municipalities to be cognizant of the reality that people will struggle financially to meet their daily financial obligations, that we keep those increases for rates and taxes and other tariffs to the bare minimum. Thank you, Chair.
Thank you. I allowed Honourable America 3 minutes, so I'll allow member from the ANC, if you'd like to pose your question for 3 minutes.
Thank you, Chairperson. Hello?
Yes, please start. Yes.
Okay, thank you, Chairperson. Firstly, I would like to support our Chief Whip, Honourable Lecker, on the proposal that we put on hold the next presentation and consider it for another day. And also, I think in the resolution, consider the value add, I think in versus what Member Dagmo was raising about this particular ad hoc committee versus our normal committees. On the questions I would like to pose, one is that on the funding, I think the department tells us about the dashboard that also indicate funding sources. Can the department specifically on this session just give us what in the city of Cape Town, what would be, the funding sources that have actually been benefited for or received in regard to, COVID-19 to date, in terms of the categories that are there, that is both, your grants and others. And in addition to that, with the other municipalities, can that report follow to the committee? But if they can share quickly about the city, since this is on dashboard and a click of a finger, as they are part of the session. And secondly, the department also mentioned to us that they do planning, that is assist municipalities to set up plans, and also interpreting the national regulations. Now, I just want to understand, is this done in-house by, for example, some of the officials of the departments, including the legal units of the department, or is this a source externally? If so, can we be given what are the cost implications to this point? And then also there was a mention about the issue of the dashboard also assisting, I think, the province to monitor this process. I wanted to understand that in view of all the interpretation, the plans that are placed by the province in supporting municipalities, who actually manages that there is actually compliance, to these advices through the plans, through the guidelines that we have seen, who actually monitors, and is there through the dashboard a rating system that can actually tell us at this point, as Minister says, we all want to ensure that we flatten the curve. Can we then be able to be told, where, in terms of that particular system, can we rate our different municipalities, including clusters? And maybe the department also can tell us if through the cluster of the economics, are we winning when we look at the reports we are finding of the retail sector, given the number of infections that we have been seeing in that regard. My last two, Chair, is that on the quarantine, Come again?
If you'd start to wrap up, please.
Okay. On the quarantine, I think you were told that there are others that are paying privately. Can you just explain who are those and whether corporates are actually all required to actually pay for their employees who actually go on quarantine? So how do you distinguish between those who pay for the quarantine service and those who do not pay? Thank you.
Thank you, Honourable Nkondlo. Good.
Thanks, Chairperson. I want to come back as well to the question around the self-isolation and quarantine that I raised earlier. So the response was basically that the province is allowing individuals to decide whether they are going to self-isolate or private isolate and private quarantine when they've tested positive. But my question was really was whether this was the best way for us to be dealing with this, given that we have a high infection rate, and whether there shouldn't be a mandatory either private or public isolation or quarantine. So in other words, either in a private hospital or in a public facility if someone can't afford it, so that we don't have people who have the discretion to go to their homes, who we cannot monitor, and who are claiming to be self-isolating or quarantining, but who are not, and who are in fact infecting others. So my question really is, given the high infection rate, whether this protocol shouldn't be adjusted so that people are required to isolate or quarantine as directed by the state in a facility that can be monitored. And then my second question, to go back, again, I didn't feel it was answered properly. I was saying that the president has indicated that at some point there would be a differentiation by area as to the risk-adjusted phasing out of lockdown or phasing from one level to another. And my question was whether this provincial command council or provincial structure has started to prepare for that, if it is going to happen. And the answer I got was that the Central Karoo has asked for a special dispensation, which is a reactive response. I'm asking whether there is planning for this new dimension to how you move from one level to the other, and whether there's been interaction with the Department of Cogta or the Minister of Cogta around what this means so that we can plan for it properly. Thank you.
Thank you, Honourable Heron. ACDP.
Thank you, Chair. If I can just latch on there to Honourable Heron. If you can remember, I've also asked the same. I made a statement in the House about the different levels and that we look at it per district. And in my statement, I gave the municipalities, and Central Karoo was on North and is still on North. But I also gave other district municipalities like Garden Route that was on 62, and the Overberg district municipality that was on 19. And is that the only municipality, Central Karoo, that they've put to the cabinet to address to the president or to Cogta to have that level lockdown lowered? So that was because I've spoken about it. I think they've mentioned it, that the problem that we have is that people cannot even afford to pay their municipal accounts, and it's killing our businesses. So if Central Karoo is the only district, did they engage with other districts also to look at reducing the levels? And I've also addressed it to the Premier, and he said it will depend also on the policing, if they have the resources to do that. That's on the districts. The other thing that I also want to ask is, why did the department send out that circular about councillors not getting involved in food? There had to be complaints. The HOD said there's no formal complaints, and that's why there was nothing in writing, and that's why they did not act. Are they aware that there was a complaint, and I'm not going to mention the municipality, at the police station made, of councillors getting involved with the distribution of food? And also there was newspaper clippings where they did not mention the names, but that they've mentioned that it's no longer. I don't think it's happening now. It was happening previously, and I congratulate the department for sending out that circular. But what was the reason? What was the rationale behind sending out the circular? And just my last question is, I don't know. I've not read it, and we know that Strandfontein is closed. What happened to those people, and how? We had so many complaints, especially about the Strandfontein homeless, where they were boxed in. And everything happening there. Is the department doing oversight over the other areas where the homeless are put together against the will? They want to get out and all of that. How's that managed properly? Because Strandfontein was really bad, and the newspaper, the media was denied access. Councillors of other political parties were also denied access. So what is the department doing in their oversight role to make sure that these other facilities that is up and running, like in Somerset West, that we have not the same problems that happened in the Strandfontein? Thank you, Chair.
Thank you, Honourable Christians. Freedom Front Plus.
Thank you, Chair Lady. I would just like to ask whether anybody, the department or the minister, can say, in terms of disaster management, we have addressed the issue of the prisons and businesses. Nobody speaks about schools, and that is what the people mostly concerned about, schools and churches. Do this council or command center have anything they wish to take the people into its confidence? What are the criteria and what are the prerequisites for them to open schools or not to? And also the whole issue of churches, which serve as it's really, if people are in trouble emotionally, they run to the pastors, the reverends, the churches. They don't run to NGOs. They need counseling, they run to the churches. Did you think that counseling by churches should be considered an essential service? Or is religion not essential? And in whose eyes? And what about the children opening up schools again? There's a lot of people that is very concerned that if our health workers are dying and service providers are dying, or being infected rather, what are the chances of teachers being infected and carrying the virus over to our children? You should have experts, professionals on this council, provincial council. The Act make provision for it. You should have experts there. What is the expert advice the minister has received in these regards? Thank you.
Thank you, Honourable Murray. Minister HOD, over to you.
Thank you, Honourable Chairperson. I'm going to start off by the Honourable Murray's point of order. It's a national disaster. So nationals work out the systems, the structure under which we need to operate, and therefore we operate under that structure. The advisory forum, we do have a permanent advisory forum. It's not something that we just create when we need it. It's inclusive of community leaders, disaster management specialists. That's the cluster, and we work with them all the time. And we met once a quarter, at least we met with them. The rest of the structure is currently under the national structure, and we've got a lot of experts on the panels to advise us. But even if you read a bit wider, you will accept that worldwide, there's not a single person who's got the answer. So we need to be able to put our ideas on the table and to differ with one another and to look at how the system the best we can implement to get our schools back on track, to get our economy back on track, because COVID can lead into other disasters, as you all know. So yes, we look at the teachers, the schools, etc. There's teachers who's got this COVID virus and they're not in the class currently, honourable member. So the churches is very important to all of us. We've started, or we've got a interfaith forum where Dr. Ivan Meyer and Minister Marais and the team met once a week, every Friday. They sit with them. We also pull them into our decision making to help and to guide and to talk to their community, because they still do have their sessions with online sessions. We've all learned how to do this now. Then to go back, Honourable Chairperson, to the water tanks, the operational cost will be for the municipalities, also the installment cost, and also obviously to keep water in the tanks. The IDP and the budget processes, the regulations make provision that the municipalities can now have virtual meetings. They can deal with that, the financial implications. That's why I've alluded in the beginning, saying that we need to keep a close eye on sustainability of municipal finances going forward, and that's a broad statement because it's the whole system that we need to look at. Obviously, people will be under pressure, but municipalities don't have a bottomless pit. And as the question to the province, what can we do to help? Well, we also don't have a bottomless pit. We're also in the bin. We also need to realize that from the national announcement from the president that the 130 billion is an internal shift, it's not new money. And from there, provinces will need to come up with around about 30 billion. And I think our share will be anything from 2 to 3 billion rand. So we need to cut again, and we will enter into very unpopular discussions. As leaders, we just need to accept that that's where we are. If you look at the municipalities currently on the grassroots level, there's already a 20 to a 25% increase in applications for equitable share. So that's up to a quarter. That's people that needs to get free basic services from the municipalities. That will put huge pressure on them. And then obviously we need to get the economy started. Chairperson, I don't understand, or I don't think it's quite fair, the comment that we need to actually find a new date for the rest. Of course, the other presentation is also a very thick presentation. We've put a lot of work in. We've got a lot of people on standby. And just for the standing committee to realize that a lot of people put in many hours up till now to manage COVID. We must not think there's not pressure on our staff. There's huge pressure on our staff. Sit in meetings till midnight to try and solve and find their way, and also to support and to help the community. So I think it's important that we do give them an opportunity to present. Then I'm going to leave some of the planning, the regulations, the clusters. I think the Q&A on Member Herron's question is, I think the simple answer is that we're not 100% sure. We currently, as I sit here and the department is here, the rest of my colleagues is in the cabinet meeting, and one of the issues is the Q&A sites and how we can manage it, and also the cost to that. Looking at the high peak scenario where you can end up with to 45 to 50,000 people in isolation or in quarantine sites, and the cost to that, and it can get to a stage where it's not affordable anymore. And how can we have a combination of getting people to self-isolate where possible, so that we can really help those who can't, etc. It's a whole system, and I think the Premier will be in a position to answer that question better after today. We're also preparing for the President, to talk to the President and give him the practical problems that we struggle with. Also, if you talk to our communities, there's also a big pushback from communities saying we're not going to go to a facility. Now, we're also not a police state, so we need to listen to people, and we need to come up with a plan to say, okay, if you can self-isolate, that's the conditions under which, and then we need to have the people, and therefore also the touch on getting extra neighborhood watchers in the system to help us to control that. Just very briefly on the ACDP's comments, also the Central Karoo, yeah, that was one example to ask, let's open because there's 0 cases currently, but we must also realize that if you talk to the expert, they will tell you for every case we've got a positive case, there's actually 6 that we don't know of, or up to 10.
So you can just multiply the figures. So there can be a lot of people that we don't know of currently because of the backlog in the labs, etc., because of a lot of people that's asymptomatic, but that you just don't pick up. So we need to understand that this is not a simple problem that we deal with. So there's no hidden agenda here. We firmly believe that the sooner we can get the economy up and running within certain protocols, I think that will be a win-win for all of us, because if people don't have income, it's got the ripple effect right through. So Graham, I don't know if you in the department wants to touch on a couple of things that I've skipped.
Thanks, Minister. I'm going to ask Colin first if he's got anything to add. This is in relation to the Q&I sites and the Disaster Management Centre. Colin?
Thank you, HOD. Just around the quarantine issues, the decision to quarantine a person and where they quarantine is a decision made by the Department of Health. I would I think it would probably be best placed there in the sense that our job in the disaster center is to support the Department of Health in the decision making around whether a person makes that call. I don't think disaster management really is in a position to actually be able to make that call. As far as the paying for the quarantine is concerned, nobody gets forced to pay for it. The minister mentioned around the very high costs that it takes, and specifically in the beginning, we had the situation where a huge amount of people were arriving by aircraft, and you'd have a Saturday night very late where people would be arriving and you'd have like 300 people. We had large groups coming back with companies, etc. So it was really a question of were they prepared to assist in that regard. At no point was anybody forced. Was there any decision made where a person was told you will have to isolate and you will have to carry the cost? But that is something that we're seeing less and less of around people actually being able to carry their costs for themselves. Thank you, HOD.
Thank you, Colin. Chairperson, Minister, if I can just maybe respond to some of the balance of the questions. So just in terms of whether there's any councillors that transgress the protocol or otherwise the regulations. In our understanding and how do we understand the code of conduct for councillors, if there is a concern or a complaint, the protocol advises that it must be raised with the speaker. The speaker must actually then do what we call a disciplinary DC committee, get it together and assess if there's any prima facie evidence and then further investigate it. And based on that and on a council decision, obviously, that then gets to the minister for a decision. So up to date, we haven't, the department, or I speak on behalf of the minister also, we haven't received any cases where there was disciplinary actions against councillors. And I think how this thing came about is we knew that we're going to issue this 16.2 million, and it is also at the direction of the minister that said we must put this protocol together so that we actually can be proactive and prevent councillors participating in the distribution of food parcels. Colin has answered the questions around the Q&I sites. I'm just checking which is still outstanding. So when we get the Honourable Chairperson, when we get the regulations, we have also established what we call a COVID-19 email, and I've got a WhatsApp group with all the mayors and all the MMs in the province, and also with my national colleagues. So what we do is any information that becomes available, with those are the regulations, the directions, or any data around COVID-19, I distribute it on the WhatsApp groups almost immediately. And secondly, we formally send it from what we call the COVID-19 email address that has been established in the Department of Local Government. And so we disseminate the information almost on the immediate basis to all the municipalities so that it can be distributed amongst councillors and further on within the municipality. So we don't, we've also made various summaries of the pieces of regulations and the directions, And Chairperson, we use our own internal capacity to make an assessment of the regulations and the directions, work with the national department, and if necessary, that advice and interpretation and analysis need to be vetted. We also work in close collaboration with the Department of the Premier, the branch legal services in relation to that. So there's no cost in relation to the interpretation on the regulations and distribution of the subsequent information to municipalities. Just in terms of the monitoring of the dashboard, obviously, Chairperson, there's a number of dashboards that we are managing. So in terms of the humanitarian relief, we are monitoring in terms of the 16.2 million, and we collaborate with the Department of the Premier that actually monitor entirely overall, not only the 16.2, but also the efforts being made by the City of Cape Town and by the MPOs, as well as education, and as well as DSD. So the overall monitoring takes place via the Department of the Premier and also the Nerve Center in that regard. I'm not sure, Chairperson, the Minister has responded to also the questions. If there's any outstanding questions, thank you, Chairperson. City of Cape Town.
Thank you.
Thank you, Chairperson.
Great, thank you. Were there any questions not answered?
Chairperson.
Yes, there were many questions not answered.
No, one at a time, please, Honourable Dagmar. I recognise Honourable Nkondlo. Was one of your questions not answered?
Thank you, Chair. My question on the funding sources was not answered. My question on who at this point helps with the planning and the interpretation, is it officials of the department or is it outsourced? And if so, what are the costs to that? So those questions, including how is the compliance being monitored and enforced through this process? Thank you, Chair.
Thank you. Any other members' question not answered?
The homeless City of Cape Town question.
Thank you, Honourable Christians. Anyone else? So HOD, if you'd be able just to respond to those, please.
Okay, thank you, Chairperson. I have alluded at the interpretation of the regulations are done internally by the department's officials. We've got attorneys and advocates within the department, and they are doing the work. And as I indicated earlier, if needed to be vetted, we also work closely with the Department of the Premier, and therefore there's no cost for external sourcing by service provider to help us in this regard. It's all done internally, Chairperson. Just regarding to the funding sources, we actually funded the 16.2 million by means of reprioritization within our own budget of the Department of Local Government, and we allocated that funding through a local government support grant. So DSD has also got funding. They've done also reprioritization through a Section 25 notice in terms of the PMFMA, and the Department of Education in terms of the feeding schemes of schools also got an 18 million through a Section 25 notice by the BPC and then fundamentally by the Cabinet. So the funding that's been used is provincial funding, but as I indicated, that municipalities have also provided support from their own funding. And when we've done an assessment of that, it was to the tune of 7 million. Now, there is ongoing discussions with the City of Cape Town around humanitarian relief. And what we understood is that the Mayor has made a certain amount available for humanitarian relief out of the mayoral fund. But there's still ongoing discussions, and we are trying get to some kind of agreement with the City of Cape Town. How do we approach and implement the humanitarian relief, particularly in the city area? I know that the Dr. Andrew Boraine is doing significant work together with ourselves in the city, with the NPOs, getting the NPOs together with food relief initiatives in the various wards within the city of Cape Town. Just then on the Strandfontein, the shelter, Chairperson, that is being reported into the cabinet. When the cabinet sits and has been reported, both the City of Cape Town reports on it, as well as the South African Police, Brigadier Zandberg. And in our discussions with the city, we're also taking it up with Hugh Cole as well as Craig Kesson, and where necessary also with the mayor, between the premier and the mayor, but also with the city manager Langelo Mandandaso. So we do discuss that, and we know that given the challenges that was in Strandfontein, that in a process of de-densifying the shelter in Strandfontein. We had the other challenges that we had in relation to home shelters, Chairperson, was not necessarily the number of homeless in shelters, but the major concern that came through was around the food relief. The National Department has Social Development has appointed a service provider to provide food, but in our understanding, we see that they are withdrawing the end of the month. That's the end of May, and we are now in conversations to see how do we can fill that gap. Discussions between ourselves, the Department of Social Development, and the municipalities. And just in terms of the shelters, there's different versions in the province. You'll find in one municipality they've actually given people one-man tents to put them perhaps in a hall or community center. Others have put them on the field, or others accommodate them in a town hall. So there's different versions of it. But as to my knowledge and how municipal managers interact with me, is around the food supply to these homeless people, and that is because it is becoming a financial burden to some of the municipalities. So as I said, in the case of the city, the mayor has made certain amounts available to the humanitarian relief. Chairperson, I think does answer those two questions.
Thank you, HOD, and thank you very much, Minister. My apologies to the Department of Environmental Affairs. I just want to test with the members. There was a proposal for having the second presentation later. However, I have consulted the parliamentary program and there are no available committee slots next week. So I'd like to then propose that we continue with this meeting until 5:30, in which case we would be able to deal with both presentations. Also bearing in mind, although it's split into two presentations, the information in them came directly from the requests from the members on this theme. So ideally, in the interest of fairness, we'd be able to deal with all of the members' inputs in the same meeting, if it is at all possible. So I'd like to then ask whether we can continue until 5:30, and then we could have the second presentation and questions around that. That gives us a little short of 2 hours.
Point of order.
Thank you, Chief Whip, if I may.
Is that Honourable Mitchell, please proceed.
Thank you, Chief Whip. Chief Whip, I support the proposal that we continue until 5:30.
Thank you. Honourable Dugmore.
Thank you, Chairperson. I don't support that proposal. We've been scheduled until 4 o'clock. It's very important that we do get these inputs, but that we are also able to program them so that we can contribute meaningfully. So I don't support the proposal I support that we use the last 45 minutes to continue asking questions because one of our members
15 minutes.
15, yeah, 1-5. That's right. That we continue using the 15 minutes to ask questions to the presentations that we've received already. And that we then, I mean, I'm even looking at the session tomorrow. The session tomorrow doesn't last very long. It doesn't seem that there's a huge agenda. Could we not slot that ad hoc committee meeting to specifically deal with this outstanding report tomorrow? But physically, for instance, I'm personally, have another commitment. I really want to be part of the process. But if we go on until 5:30, I literally cannot be there. And I think that is not fair to the officials and it's not fair to the members. Thank you.
Okay, well, I've checked with the procedural officers. They're happy to remain until 5:30. I'll have to check with the departments as well now. There is no opportunity tomorrow. We have a sitting, and Thursday mornings are reserved for party caucuses. Friday, we already have an ad hoc committee meeting, and next week the parliamentary is completely packed. The only alternate would be for us to do it on Monday, which is a constituency day. So those are basically the two options. Honourable Philander.
Chairperson, thank you. Good afternoon. I support the option that we do continue. I think members did stress the fact, the importance of obtaining this information, Chairperson, and we now do have the opportunity. So I support that we continue. Thank you, Chair.
Thank you. Let me just check, Minister and HOD, are you available to stay until 5:30?
Yeah, no, I'm available. I will shift.
Chair.
Thank you. Is that Honourable Lecker?
Yes, it is, Chair. Thank you so much, Chair, for the opportunity. I really wish to table my dissatisfaction because already had other commitments set for from 4:10 today. Due to the fact that I already knew that the meeting will be ending by 1600 hours. And so I really feel that probably because we have always been on a constituency period, we can find time and schedule this meeting for just 1 hour on Monday. Thank you.
Well, I think we'll need at least I'm proposing 2 hours this afternoon, so we'd need at least 2 hours on another day if we were to do that. So if there are members that are not able to stay until that time, we'll then have to consider meeting then on Monday afternoon, even though it is a constituency day.
Yes, Chair, could I just...
One at a time. Honourable Mitchell.
Thank you, Chair. Chair, I think the department as well as the HOD and the Minister are available now till 5:30. The reality is, while I understand the commitments by members, we must also bear in mind that in order to get the department back on Monday might not also be possible. So we must just be mindful. It's not just a matter of proposing an alternate date where most of the department, I would imagine, and the HOD can confirm whether or not it is the case, would then be able to address the concerns today.
Thank you, Chair.
Chairperson.
Okay, I don't know who's speaking.
Member Nkondlo.
Honourable Nkondlo.
Thank you, Chairperson. Can I support the proposal of Monday for 2 hours? And can we ask the department here, as we have just done, to test their availability for Monday? And I'm raising this also to say, I think because we normally get these presentations, a day or so before, I think we need also to manage the time it takes for departments. And I think this was raised by Member Mare at one point, that an hour or more for a presentation, whilst we then have a series of questions, on this presentation. Maybe it's something we must just find another way of dealing with, where at least the department 30 minutes should be a presentation, considering that at least there is a preparation, that the department assists us with by submitting these presentations upfront. So I wanted to suggest that, because indeed, if there is time that is scheduled, not all of us have got the luxury to then just extend with an hour and a half from this point. So I would like to support, and we then test from the department and you make the determination on the members that will be remaining versus those that cannot continue with the session. Thank you.
Thank you, Chair. Chair, could I also propose that in regard to the possible rescheduling for Monday, if the presentations are available, that we actually we just require the MEC to make an introduction and we go straight into questions on Monday. We actually, you know, if we have the chance now, as we will, if it is rescheduled, we can go through the presentations, prepare our questions, and actually ask them on Monday. That's what would also help to save time. Thank you, Chair.
Any other voices?
Chair Deirdre Bartman.
Honourable Bartman.
Chair, as a member of this committee, I unfortunately have already a commitment in my constituency on Monday. I'm not sure about the other members, but if you are a constituency member of the rural area, half of my Monday I also have to travel. So unfortunately, between that commitment and traveling, I don't think I'd be able to be part of a meeting on Monday. And I would like to hear the input of the department. That's the first part. The second part is our meetings are also public and on YouTube, and there are members of the community that I do think may have put time aside to listen to this input today of these particular departments. And I'm not sure if we have those particular departments on Monday that people might be able to then have the same amount of time to listen to this particular input as well. And I think we just need to be cognizant of that as well. Thank you.
Thank you, Honourable Bartman. Okay, so we have
questions.
Honourable Christians.
Chair, yeah, Mondays is a difficult day for me also because of constituency. I'm trying to think now because the minister and the HOD said they're available now.
Yes.
Maybe we can we can look at 5 o'clock then to close at 5 o'clock. It just gives it an hour, over an hour, if that is okay. I'm just trying to, because all of us, Mondays, we usually do constituency work. So Mondays is difficult for me as well, Chair.
Thank you. Okay, so we now know that there are 2 members that are not able to stay on if we continue now. Could I get an indication of how many members are not able to continue if we do it on Monday? We have Honourable Bartman and Christians. Are there any others?
Honourable America.
Okay, so it's Honourable Mitchell and America also not able on Monday.
Philander.
And Philander also.
Buerta.
And Buerta. All right, so that helps me. Then we will proceed today, given that the most number of members are not available on Monday, but most members are willing to continue today. As Honourable Dugmore suggested, we have in fact seen the presentation before and have looked at it. So I will then ask the Minister and HOD if you could sort of jump straight in with a brief summary of the presentation, because we have looked at it, and then we'll go straight to questions. Thank you very much.
Sorry, Chair. Can I just address you? That is not what I said. I said that if the meeting is on Monday, we would have had a lot of time to go through in detail the presentation so that on Monday we simply have an introduction. I never said that we had all the time in the world to go through this presentation. We went through some of it, but that wasn't what I said. And I think it's completely wrong if members are indicating to you that we cannot make the next session to simply proceed. I think it's just completely wrong.
Well, we have to look at what is the general consensus, and the general consensus is that we proceed now. The most number of members are indicating that, and more members are not able to make Monday. So therefore, in order to make the best decision for the most number of members here across party lines, we will proceed. But you did make a very good point, which is that we have seen the presentation, so we don't have to go through the full presentation in detail, which will also save time so that you're able to see as much of it as possible and then pose questions. So on that note,
a final point on this, if you don't mind, a very brief point. Some members have got constituency on Monday. It is completely possible, as is often done, to stop where you are and to actually conduct the hearing from where you are. So I counted 3 members who indicated that they were not available now. Member Lacker, myself, and also a member in Kondlo. So then you indicated that 2 members said they couldn't make it on Monday. So I'm not sure if it's a question of when you say there was a consensus, the majority of members indicated that as in favor of Monday, and you didn't even come back to us to say whether the MEC and the HOD can do Monday.
No, look, Honourable Dugmore, I have now made a ruling on this. There were only 2 members at the time who said they're not able to make to continue today. Now you're telling me there are 3. Okay, that's accepted. There were only 3, whereas a large volume of members indicated that they're not able to make Monday at all, which means that it is not a viable option to proceed on Monday. So therefore, we're left with one option, and that is to continue today.
We're going to call the speaker now and complain about this. I'm going to call the speaker right now. Thank you.
Go for it. HOD, please proceed.
Just do it.
Chairperson, thank you.
Whilst we're raising a serious issue, it's uncalled for. Let's not undermine.
Are you raising a point of order, Honourable Lecker? What is your point of order? Okay, HOD, please proceed.
Chairperson, thank you, and good afternoon, members.
Can I address you, Chairperson?
I gave you an opportunity. Okay, what is your point of order?
A point of order is about the lack of discipline from whoever that was giggling, and you're not entertaining it. Instead, you're opening an opportunity for the HOD to address us. I'm not sure.
I didn't hear any giggling, and that's also not a point of order. We'd like to proceed with the meeting now.
Can't dismiss me in that way. It's a clear sign that we are also handling our arguments as with discontent. That's totally unacceptable from you as the chairperson of this meeting. We are all expected to behave in a proper way.
Exactly.
And what you are now doing, you are actually not entertaining any of these people that are giggling. So you are allowing us.
Are you raising a point of order that somebody was giggling?
I'm still raising a point of order on you, Chairperson, on you and your manner in which you are addressing this meeting. It is as if you are not taking anybody with considerable intent to address issues in a decent manner.
Honourable Lecker, I don't take that point of order because I have consulted and we had numerous voices across party lines. And Honourable Lecker, I have made my ruling about proceeding today.
I'm not your arrogant chairperson. Let me say that up front.
Honourable Lecker, I have made my ruling. HOD, please proceed.
Whether you make your ruling or not, you are arrogant.
Okay, HOD, please proceed.
Sorry, I'm leaving the meeting. I hope you have a good discussion, but I'm leaving now. Okay, bye.
Thank you. Please proceed,
Can I
Mr.
proceed?
Van Zyl. Yes, please do.
Can I just get clarity from you? You want us to do an abridged version of the presentation because the way we had prepared was that I would give an introduction and then my 6 colleagues would each do a short overview of their sections. Now, what we can do, because the presentation has been made available, is that I will keep my introduction very short and then ask each of the colleagues not to speak to every word on the slide, but to give you an overview of their sections. I think in that way, I would suggest we could probably cover it in 25 to 30 minutes.
Excellent. Thank you very much. Please proceed.
Thank you. Chair, I think that following the request, I would make 2 observations. The first is that the brief that your committee has given us essentially addresses most of our environmental management function in my department. We do, of course, also have the other leg of the department, development planning, which we're not addressing today, but I would just make one observation, and that is that we've worked and continue to work very closely with our municipalities in particular, and have provided 2 practice notes in collaboration with them, particularly in respect of how we can make planning applications both at the municipal level and provincial level remobilized. But I will not go any further into that this afternoon. In respect of the environmental function, I think that my colleagues will address your committee on the aspects that you've asked us. Waste management, Eddie Hanekom will speak to us. Water and wastewater, Wilna Kloppers. Air quality management, Dr. Joy Lena. Biodiversity, coastal and marine resources, Marlene Larosse. All from my department. And then wildlife, nature reserves and ecotourism, Dr. Ernst Bart, Chief Director at Cape Nature. The presentation is on, and I would, Eddie, you can go right on to your slide, which is the divider slide leading into waste management.
Okay, good. Sorry, Pete. I'm just helping my colleagues out of the room. They started very excited. I apologize for that. As was requested, I will go swiftly through my presentation. The first thing, and thank you for the opportunity, honourable members, to address you. And yeah, this was quite a significant event, and I think nobody really planned for this kind of event. It's the biggest disaster of our time. And this is the risk and challenge that we initially experienced, is the waste workers is seen as crucial to the prevention of transmission in this infection of the coronavirus. And waste workers are second in line after the health workers in the defense against this COVID pandemic. Initially, we had to bolster the internal capacity of the department to work in these different circumstances, now from home. We had to look at the protection of waste workers, our own staff, and also how to control informal salvages. Then to manage the waste from households with COVID cases. It was quite new, and we had to do risk assessments. Then also to assess the availability of treatment and disposal capacity, and then also to see how can we assist the waste pickers during this pandemic. The next part is we have to give guidance to municipalities to handle this waste type. So we've developed a protocol and a guideline, and in doing so we liaise provincially, nationally, and globally, learn from other countries. At that stage, we learned quite a lot because Italy was actually the epicenter of the infection. Thereafter, they've been overtaken by the United States. And we looked at also the isolations and quarantine facilities. We follow a risk-based approach to identify infection risk, and also to look at different service delivery models that's affordable, but we also deal with the risk. Then we developed a guideline through a consultative process with municipalities and the Provincial Department of Health. And we also make sure that this guideline is backed to give it legal backing with the Western Cape healthcare waste legislation that is practical, user-friendly, and that we also look at specifically at the cost. Then we develop it as part of the quarantine and isolation technical team, and this guideline will form part of the Western Cape policy for operationalization of quarantine and isolation facilities. Then the next one is actually to a protocol that we have to develop to advise local authorities on how to deal with the COVID cases. Again, we liaised internationally, provincially, and globally. We specifically learned from the International Institute of Solid Waste Association. We looked at how long the virus can live outside of a human host. And what I used here on the slide for you is just a very credible source, the New England Journal of Medicine. It's in the United States. And for instance, they say outside of the human host, this virus can live for 3 hours. If it's on polypropylene plastic, it's for 3 days. Cardboard's 24 hours. We follow this risk-based approach, guided by practicality and affordability, through a consultative process with waste managers, environmental health practitioners, and Provincial Department of Health to come up with this protocol. This protocol, I'm not going to cover what the protocol actually cover, but we try to deal with every aspect of a protocol with designating waste management workers, separation at source, that can't happen here, the storage, the containers, dealing with the risk, awareness, protection of workers also. On the right-hand side of the slide, you will see a little bit of the examples that we use for creating awareness. Then coming back to the guideline for the isolation and quarantine facilities, this is just what it contains and the application of it. Seeing that we don't have a lot of time, I'm not going to go through that. All of you can read. Then very
crucial in this response is to coordinate and not to duplicate, and to standardize in our response. So we established an intergovernmental waste management work stream. This work stream comprised of two sub-work streams. One is a municipal waste managers work stream. The other one is of environmental health practitioners from the districts, the Metro and the Provincial Department of Health. We meet weekly and online meetings, and it's very successful. The functioning of it is coordinating of our waste management services, dealing with challenges, sharing best practices. This is very important that we learn from one another. And as the minister say, as the aeroplane flying, we're learning from one another. And the monitoring of waste management service, and to identify early enough areas of intervention. Then also to provide technical support to the municipalities. We also established a WhatsApp group to further improve coordination, sharing of information, and giving technical information. Then I'm just showing you a couple of photos of waste workers from different municipalities in operation. You see all of them has got the necessary personal protective equipment, and they're doing quite a good job. Then very important, we also had to assess the availability of treatment and disposal capacity for this province. Now the Western Cape has got 4 licensed healthcare risk waste treatment plants. One is an autoclave, the other one is like a big microwave electrothermal deactivation plant, and 2 incinerations, one in Cape Town and one in the George area. He has got 71 operational waste disposal facilities and 1 hazardous, high hazardous waste disposal facility operating by the company EnviroServe. These facilities are monitored, and at this stage, I can assure you we've got enough treatment and disposal capacity, and should the pandemic escalate, we've got a plan B also in place that we can set in motion. We got a photo of our Provincial Environmental Management Inspectorate also doing inspections now during this time at the treatment facilities. Then our summary, what did we learn from it so far? You asked specifically for waste data. At this stage, it's a bit problematic for us. There's the decline in general waste generated and disposed because a lot of industries closed down. And but there's definitely an increase in illegal dumping, quite a significant one, because some of the facilities are closed due to the risk. And there's a definitely increase in healthcare risk waste generation, treatment and disposal. Now, when this pandemic jumped onto us, the biggest part that we have a full month's information is actually in April. And for general waste, I think we are quite comfortable with the information that's generated. But what happened, because of the lockdown, we had to reduce personnel to protect them. And I think at that stage we also had to lengthen the time that they have to report to our system. So we're a bit behind with it. And in the case of healthcare risk waste, we couldn't at this stage account for specifically COVID waste. So we had to make programmatic changes, and we're in the process of finalizing that by Friday. We're about a month behind, and from there on we'll have good information to monitor trends. Now the service continues throughout the province, and I mentioned we got enough capacity to collect, treat and dispose of waste, of healthcare waste also during this pandemic. All the municipal workers are provided with PPE and they're using it as far to our knowledge. But I think it was mentioned a couple of times, this pandemic had a severe economic impact on the waste management sector, specifically on the informal waste industry and on waste pickers. And then we're just playing our role with technical assistance. I'm going to go very quickly to the waste picker support. I made an amendment to the last slide in this presentation. So if you have it, I beg for forgiveness. And because there was not a lot of movement and informal sector recycling were not allowed to continue, it had a terrible economic impact and it wiped out most of their livelihoods. And the National Minister of Forestry, Fisheries and Environmental Affairs rolled out a relief program for the waste pickers, which was actually quite a good initiative. And it's 500 vouchers per province and 200 Rand per voucher. And the vouchers could be redeemed at this, shopping centres, ShopRite, Checkers, USafe, Pick n Pay, Clicks and Dis-Chem. And it was sponsored by Coca-Cola, Plastics SA and various other packaging product responsibility organisations. And it was a total of 785,000 Rand was donated. All the provinces had to respond, providing names, ID numbers and cell numbers of the waste pickers. it was a major exercise and a big challenge because a lot of these persons don't even have a cell phone, or if there's a cell phone, it's sharing the camp between a couple of these waste workers, and it's quite a problem. So we had a couple of times had to sort of ask municipalities to get the information and then provide it to the national department to process it. You will see of the 28 local municipalities, only 17 responded. The others didn't respond after several requests, but we're trying still. And then just a sort of a breakdown of the payment analysis. You see, in total, there was 102 submitted, not just from our department, but also the recycling industry submitted. And we had to really have fancy footwork to coordinate that. And you will see at this stage, 225 was paid out, and there's 347 is not paid or pending, and we're trying to resolve that. I'm through with my presentation. Thank you so much for listening to me.
Thank you.
Wilner, please come in.
HOD, are you going to introduce the next speaker?
Acting Chairperson, yes. Wilner Kloppers, please come on. Eddie, can you go forward and let's get to the air quality section?
Okay. I'll have to bear with me. There we are. Okay, now the air quality section.
Okay. Dr. Lena, please come on.
Thank you, HOD. And so are we going to go into the crematoria? So in terms of the crematoria, in terms of air quality, this is the preparedness of the crematoria in terms of handling cremations per day. And so what has happened in terms of the atmospheric emission licenses, they're all licensed in terms of Section 21 listed activities in terms of Category 8. And so just in terms of this slide, it shows that the crematoria, they would basically have, if you base on the assumption of 1 cremation per hour over a 24-hour period for those 5 crematoria, then you would basically have, this is in terms of the preparedness, and with them also complying within the minimum emission standards. Okay, next slide. Okay, sorry, there we go. So then in terms of the status of the crematoria in respect of repairs and abatement, so again in terms of their preparedness, the Maitland crematorium is functional in terms of cremator 7. One of the cremators do need repairs, and then they have the twin cremators that are not in operational at this point in time. They are backup cremators, so it does not, so in terms of cremation, it can still continue at the facility. And similarly at Durbanville Memorial Park, there's also repairs that is needed in terms of one of the cremators. And so that is basically being looked at this point in time. And then in terms of the next slide, which is in terms of waste management. So there's a medical facility which handles healthcare risk waste. And they have been granted a provisional atmospheric emission license by the City of Cape Town. However, the license expired, and so the department undertook a EMI site inspection at the facility in April, and has advised the City of Cape Town in terms of exploring options in terms of NEM Aqua, to as mentioned there. And then, in terms of the question was also, what is the air quality like in the province during lockdown? And so this was a screen grab from the South African Air Quality Information System. It is an app. Anyone can download the app. The public can download the app from the App Store, the Google App Store, and if you just type SACWIS, you will be able to download that app, and you will get real-time reporting or live reporting of stations across the country. And the air quality index basically ranges from 1, which is very good, to hazardous as 10. And I just need to say that it is live reporting. So what you see on the app is basically real time. And if you come back later, or if you do it an hour later, it will change. And you cannot go back in time. You can so it's only basically what is happening in real time. So this screen grab was done on the 8th of May, and it is basically showing that the Western Cape's air quality is good. And then, next slide. This is just the stations in terms of the air quality monitoring stations. So for our department, we have 2 stations reporting to SACWIS, and then for the City of Cape Town, those are their stations, and all of them have reported good, very good on the day. Okay, if I can go to the next slide. There we go. Those are the stations that the Greater City of Cape Town, Greater Cape Town area is reporting. If I go into the next slide again, you have at Plattekloof, this was a screen grab that was taken on the 9th of April. And there you could see that it was air quality was moderate, and the index basically drove what the air quality is like. A couple of days later, it was it's good again, and also a later screen grab of that also showed that it was good. Next slide. So this is our air quality, one of information from our air quality monitoring stations. And here you can see that we looked at the air quality from the 1st of March to the 6th of May. And you can clearly see there's a decreasing trend in the NOx, particulate matter, and sulfur dioxide, so the nitrogen dioxides. There's definitely a reduction, and this is possibly reflecting a reduction in transport activity, which we saw in Stellenbosch. And then in the next slide, you will see okay, there we go. For Stellenbosch, we looked at the daily cycles, and we just chose, as an example, we chose this one, which is CO. It's a greenhouse gas, and pre-lockdown is the red. And so you can see that it was quite high in terms, the concentrations were quite high, and it ranged between 410 to 430 parts per million. And during lockdown, there's no diurnal trend really visible. And it's also, the CO2 also averaged around 418 parts per million, which is very much similar to the global average. And again, this is sort of reflective of indirect traffic management in the area. During lockdown, there's less cars on the road, so you see also the diurnal trend drops. Next slide. In terms of George, where we also have a monitoring station, we see a similar trend during lockdown. Over a short period, you can see that sulfur dioxide and ozone have declined. However, it wasn't very much apparent for NOx. Next slide. Then in Khayelitsha, we did not see a visible difference in the air pollution, in the air pollutant concentrations measured during lockdown. However, we did see that there was a shift in the diurnal peaks. It was literally 3 hours later, and this could be during because of the lockdown, in terms of the transport patterns or just the activity in the area. So there's a lot more that we need to look in terms of this data. Next slide. So that's the summary slide. Just in terms of the crematoria, there's some repairs that need to be done. And we are working on that with the crematoria, and also in terms of the facilities, the waste facilities, also working with the licensing authorities on that. And then there was a definite decline in criteria pollutants in the area, and it could be due to the traffic management because there's not a lot of cars on the road. So you definitely see, and also the industrial activity that had reduced. So it definitely reduced the concentrations in the air pollutants that we've measured. Thank you, HOD.
Thanks, Joy. Marlene?
Sorry, Pete, it's Wilna here. I hope you can hear me now.
It's a bit faint, so if you could perhaps speak a bit louder.
Yeah, it's Wilna. I was meant to talk about the water, so should we come back to the water and wastewater in the end? I had a problem earlier, sorry about that.
Yes, please proceed.
Okay, colleagues. Can you maybe go back to the water slides, please? Okay, thanks, Edie. Just to talk about the risk of the virus with regard to water and wastewater, thank you for that. Shortly, starting with what we do know about the coronavirus, and that is that the main modes of transport is through droplet transmission, but also through contact nodes. So I think it's important to note that. And then secondly, also the virus is sensitive to heat and also is highly susceptible to standard disinfection methods. That is important to note. So when we look at the risk in terms of drinking water, it can be stated that normal tap water and properly treated water is safe to drink, and people without access to tap water can actually also disinfect the water using chlorine or normal bleach, but also to boil the water. That is quite a good method of making the water safe to drink. And next slide, please. That would we move into the wastewater part of things. So I'm sure people have seen the international research, specifically from the Netherlands and the USA, that showed that the virus has been detected in wastewater, but it's important to note that this was not infectious virus. It is only fragments of the RNA. So the virus is not viable once it's in wastewater. And there has to date been no reports also of fecal oral transmission, although there is a lot of research still ongoing. So it is an open field of research, but there has not been any reports of that mode of transmission. And therefore, the wastewater, the current wastewater treatment processes that are used to treat wastewater is safe in terms of COVID, because they are designed to treat viruses and pathogens that are actually much more robust than the COVID-19 virus. However, it is important to note that the process controllers working at wastewater treatment plants should be wearing their standard protective equipment to protect them from all viruses, even especially those that are more robust than the COVID-19. And I think there's also been quite a number of research or media reports of the presence of the infected virus remnants and the use of those as a method of surveillance and early detection of the virus. The Netherlands again has mentioned that where we could possibly use this to pick up areas where there is maybe a high prevalence of COVID-19 positive cases, which is...
Sorry, ma'am, can you speak a bit louder? It's very soft.
Okay, I'm doing that. So using the remnants of the virus in the wastewater, it can be used in terms of surveillance to pick up areas that may be priority areas for COVID-19, where even when that's not been detected through proper testing of actual patients. And it could also be used as a surveillance to pick up a re-emergence of the COVID infection. However, this is specialized methodology and it's not been done widely, although there is some research also going on in South Africa in this regard. Next slide, please, Eddie. Next slide, please, Eddie. Thank you. Then I think there was a specific question from the committee around the possible increase in wastewater volumes since the lockdown and related to the personal hygiene that is recommended in terms of managing the COVID virus. This information is not reported to us as a general rule. It's reported to the Department of Water and Sanitation, and it's not readily available, unfortunately. Sometimes the information is also a little bit old. But looking at the City of Cape Town's water use, there has been a slight decline since the lockdown. And the reason for that is mostly because of industries and commercial enterprises not operating as normal. So it seems as if the additional use of water to wash hands did not have a marked influence on the water use, and in fact it didn't, there was no increase in that. However, once all factories and commercial enterprises are opening again with the lockdown being lifted, it might be a different story. And I think Colin or someone mentioned earlier that we are still also concerned about the rainfall and our water use going into winter. Lastly, I think I just want to mention that informal settlements or people using shared facilities, although there are no reports of fecal-oral transmission, those areas are representing a higher risk because of the difficulty to maintain the social distancing and to use shared surfaces. So that's all from me for now. Thank you very much. Thank you.
Thank you. Eddie, if you could move it forward to Marlene's section.
Members, colleagues and guests. Departments in Cape Nature are...
Hang on, sorry, the sound is very bad.
I think there's someone with the mic on still.
I'm just going to mute all, and then if you just unmute yourself. Okay, please proceed. Let's see if that works.
Thank you very much, Chairperson. Honourable members, colleagues and guests. We are also the lead agency for coastal management in the province, and we work very closely in cooperation with Cape Nature in marine and coastal and estuarine management. And it's just important to emphasize that ecosystem goods and services are at play in this arena, and they provide for the primary production in the province. So most of the areas that provide such ecosystems, goods and services are actually outside of formally protected areas. However, we have asked to be focused on wildlife management and conservation management. Wildlife and anti-poaching are included as essential and permitted services, and the relevant officials have permits and are working. However, delivery is being impacted in terms of budget uncertainty, and specifically with respect to the rollouts of our provincial and coastal management programs, including our program on the biodiversity economy. Budget implications thus for COVID-19 in terms of reprioritization of our budgets are still emergent, and programs, especially involving stakeholder engagement, for example, our estuary management forums and the management programs on the ground, will probably need to be rescheduled once we have budget certainty. As the members would know, all our protected areas and parks are currently closed, including all pay and open access areas, which includes, for example, Cape Point boulders, Table Mountain, etc. Next slide, please, Eddie. Our restrictions on tourism and travel will obviously result in significant impacts on the incomes of both national and provincial protected area management authorities, as well as private facilities and all nature-based tourism in general. And just to highlight that this is a key component of our biodiversity economy and indeed our economy in the Western Cape, the nature-based tourism. As mentioned before, conservation and enforcement functions are continuing in the biodiversity, marine and coastal sector in close cooperation with national and local partners under Operation Pakisa, Oceans Economy. Dr. Bart will elaborate on that shortly. We've received many queries around the continued work on ecosystems, for example, alien clearing, wetland rehabilitation, and whether that can continue. We're working very closely with our national department in terms of the natural resources management component to working towards the reopening of these programs, and also in the same sector working with DDAT, our sister department, on an economic recovery plan focusing on resilience. So we are positioning Western Cape Ecological Investment Framework as an essential approach to generating work opportunities and value chains, including exports, while simultaneously addressing the risks of climate change, water risk, fires, flooding, and land degradation. Next slide, please, Eddie. For clarity, colleagues, the slide shows national parks in the Western Cape that are managed by SANParks, and it includes Agulhas, Bontebok Garden Route National Park, Karoo, Table Mountain, Tankwa, and West Coast National Parks, and also the associated marine protected areas. So we work in partnership with our national agency, but they have a very specific mandate to manage national parks. Our last slide, please, Eddie. So just to note for the members that protected areas and conservation areas fall into various categories and are managed by different management authorities. Cape Nature now will take us into a more detailed analysis on impacts on wildlife and protected area management in the context of COVID-19. Thank you, members.
Thank you very much. If we could, condense the Cape Nature presentation, we'd be very grateful.
Thank you, Chair. Honourable members, thank you very much for the opportunity to present. I will be as brief as I can. So to start with, just the next slide will show that, and just to indicate that the Western Cape Province is one of those very special places where not only our fantastic landscapes, seascapes, as well as biodiversity and ecosystems play an important part in what we do, what we have here, but also the fact that people in history within the Western Cape Province are also very prominent, from the Southern Cape coast bearing witness to the dawn of human cognitive development, as well as the rich cultural history of our Cape Fold Mountains, such as the Cederberg, the Boland Mountains, Swartberg, that can truly be regarded as places of, and also as cradle of the first people who occupied the land and who lived here. Next slide, please. The next slide, Chair, will indicate that as Marlene has pointed out, that the Western Cape Protected Area State comprises a number of provincial nature reserves, national parks, private nature reserves, mountain catchment areas, a whole array that make up the protected area estate. However, I think the next slide will indicate to members that the fantastic biodiversity and ecosystems, next slide, Eddie, please, that the fantastic biodiversity that we have in ecosystems in the Western Cape, as Marlene also pointed out, is not confined to the protected areas and national parks of the Western Cape. This map shows that there is a substantial and extensive portion of our biodiversity both in the fynbos kingdom, the succulent Karoo, and also the general Karoo outside of our nature reserves. And that is why we need to look broader. And just to confirm that Cape Nature works both inside our protected areas as well as outside. The next slide, please. Here I will be as brief as I can, and I'm going to concentrate on some of the essential services that we perform. Like many other departments, organizations, and entities, we have had to abide by the national lockdown regulations. We've been working in keeping our nature reserves operational, however close to visitors and ecotourism facilities. However, essential services like fire management has continued. We have done a number of fire season assessments that have been completed of the previous fire season. We are slightly concerned about the closing window of opportunity that we have to conduct fuel load reduction. This is a very important process in fire ecological management, where critical prescribed burns are needed in certain areas. We've only had, fortunately, only around 6 fires since the lockdown on 27th of March. One of the important fires that we managed to put out is an underground peat fire that was started by lightning in the Verlorenvlei, just outside of Elands Bay. The unfortunate thing is also that because we have had to withdraw our contractors that do alien clearing and our fire breaks, fire suppression, fire prevention measures had to be withdrawn from the field, and we obviously are going to need catch-up plans. And as I speak, we are awaiting final guidance from National Department in terms of getting our contractors back into field. As you can well understand, the contractors are at the moment at home, not really working, but we are desperately trying to now get all the COVID lockdown protocols in place to actually allow them back in field. Next slide, please. So we also manage 5 marine protected areas within the Western Cape. These are nationally funded by our national department, and obviously some work planning will have to be rescheduled as far as the lockdown period is concerned. I'd like to also concentrate, Chair, on the compliance part of our work, which is also categorized as essential services. We have had to center most of our compliance and enforcement patrols around our coastal and marine reserves, which are known poaching site hotspots, and we have, where we could, within the capacity, increase the number of coastal patrols. Marine poaching hotspots, as I indicate in the slide there, Chair, remains unfortunately highly risky, as seaward entry is obviously usually used in the MPA or the marine protected area situation. And while the marine protected area boundaries are diffused and at sea, there are literally no fences, it remains difficult to deal with seaward entry into our marine protected areas. However, I would like to point out the fact that as far as environmental management inspectors, so-called green scorpions, are concerned, I think the Western Cape is is well off. Cape Nature has 56. Our Department of Environmental Affairs Development Planning has 72, and our Western Cape local authorities have got 88 inspectors trained and appointed, and this makes a total of around 216 so-called green scorpions, which is a formidable force to have at this stage, where poaching can be expected in certain areas, in certain hotspots, to escalate. Next slide, please. Chair, very briefly, we've had generally fewer anti-poaching compliance patrols. However, we have increased the number of patrols in our coastal reserves, marine protected areas, and especially in the Matsikama landscape, where we've had increased incidents of poaching, especially of our succulent plants growing there. It's very special then. And we have also dealt with, during the last few weeks, a number of transgressions as far as the Nature Conservation Ordinance is concerned, as well as the Marine Living Resources Act and the COVID-19 lockdown regulations. Two cases stand out. In April, we've had 3 cases where groups of hikers illegally accessed the Cederberg Wilderness area. And on the 30th April and on the 8th of May, we had 2 arrests of poachers of succulent plants from the Knasvlakte area. In total, almost 11,000 individual plants. So as you can see, we've maintained our presence in the off-reserve area and landscape. And we managed to do a lot of work in that regard. Next slide, please. Chair, as far as special projects and in terms of ecological infrastructure, the clearing of invasive alien plants from our nature reserves, and as well as wetland rehabilitation, we have continued mostly with planning. Unfortunately, most of our conservation partnerships are centered around these programs and contractors and teams clearing alien plants, cutting fire breaks. And unfortunately, with the withdrawal of contractors, we had to continue with our planning for resuming activities when the contractors will be allowed back in field. Next slide, please. So therefore, one of our big projects that we are involved in is the Greater Cape Town Waterfront, which is a partnership-driven project with the City of Cape Town, the Nature Conservancy, working on fire, high-altitude contractors, as well as WWF South Africa. Unfortunately, there has been some delays in this regard due to the contracts placed on hold. However, we have continued with planning. We are ready to get back in field, and as soon as we have the go-ahead, the work will start again. Next slide, please. So, as far as the continued impact of COVID-19 lockdown on our work and so on, Chair, I think the most significant impact has probably been on stakeholder engagement. The lockdown has resulted in the immediate shutdown of our planned stakeholder engagement processes, which include but are not limited to our protected area advisory committees, especially also environmental education that we cannot do with field trips and doing with local communities. The next slide, please. Will also show that physical engagement with municipalities, NGOs, and especially communities in our coastal and estuary forums as well have been taking a backseat. However, Chair, the point at the bottom there, number 9, about the socioeconomic impact is something of concern, obviously. Most of our contractors are small, medium, and micro-sized entrepreneurs or enterprises that come from local communities and in and around our nature reserves. And unfortunately, the lockdown has had a significant impact on revenue and livelihoods. However, as I've mentioned, that we are virtually ready to get the contractors back in field again. Next slide, please. Chair, very briefly, we have managed to maintain our presence and our essential service delivery off reserves or outside of our protected areas by continuing to issue biodiversity permits. Unfortunately, no physical inspections could have been done. We've done a number of human-wildlife conflict interventions where wildlife management services continued. We have managed to draft and complete landscape compliance plans, as well as scaling up anti-poaching patrols in these particular hotspots that I've indicated. The next slide will then just 2 final slides, Chair, from my side, is to just indicate that also our lockdown period has had quite a significant impact on our ecotourism and access service delivery. We've had a number of sector the ecotourism sector obviously is very, very slow. I mean, it will recover very slowly. And then, of course, this has a knock-on effect in terms of forecast revenue. And as far as our short to medium-term focus is concerned, we will be focusing on the domestic market. We believe that we are looking at the emergence of a so-called new customer. We believe that health and safety and social distancing for visitors will be important. That is why we are ready to receive these people in terms of far-off places where we can actually realize these expectations. We are looking at driving the marketing response through postponing our bookings and not cancelling. Obviously, it will have an impact on revenue. Then, of course, also, Chair, our tourism maintenance and upgrades have had to be temporarily stopped as well. The final two slides, Chair, will be just indicating that in terms of the lockdown, in terms of the closing down of our tourism facilities, will obviously have quite a significant impact. We expect that we can look up to about 17 million, or about 40% of our forecast revenue for this financial year that would be lost. This is, of course, significant in terms of maintaining our balanced budget. However, we do have an indication that winter generally generates less revenue, so the real impact may be lessened in this regard. The next slide, Chair, will then just indicate that also investment from Cape Nature in terms of cloud-based ICT information services, reduction in hardware costs, also our reduction in variable costs such as travel, by doing online meetings and online engagements, as well as cash reserves built over the last few years from interest income and surplus revenue, will further buffet the lockdown impact. Chair, I think the last slide is just to acknowledge contributions by my colleagues, and that will be my story. Thank you so much.
Thank you very much to you all for your presentations. HOD, if you're okay with that, I'm going to jump straight into questions from the members.
Happy to do, thank you.
Thank you kindly. As usual, 3 minutes per party, starting with the DA.
Thank you, Chair. I trust you can hear me. Chair, my first question is a general one, and that is that the death rate in South Africa has temporarily decreased because of the lockdown period. Now, in order for us to deal with this pandemic and this crisis, we need to know the extent of, what can we expect. They say the first step in trying to resolve a problem is to understand the problem. And now my question is just looking at what some other countries have experienced, have we received any indications regarding the potential numbers of affected persons, such as the numbers of expected deaths? And there I'm referring to the crematoria from, for example, the Command Council dealing with the pandemic. Then to Mr. Hanekom, do we have, or is there any international evidence of cases of virus infection that can be linked to the handling of household waste? To Dr. Kloppers, running water is not always freely available at sites where one would like people to wash their hands. Do we know what the risks are if people need to share soap and water with a potentially infected person for the washing of hands? And to Dr. Lehner, as you reported, a number of crematoria are currently not operating due to maintenance issues. And I presume some of these may be privately owned. To what extent are you liaising with them? And what are your expectations as to when they would be commissioned again? And my last 2 questions would be to Dr. Bart. The first one is, the frequency of roadblocks seem to have increased significantly as the movement of people are strictly controlled. And this seems to pose an excellent opportunity to curb the smuggling and illegal movement of protected species. To what extent does your environmental management inspectors liaise with and assist the police, traffic police, etc., at such roadblocks? And then secondly, to Dr. Bart, just for interest's sake, people have been surprised in many countries by incidents where wild animals have come out of hiding and almost reclaimed open and public spaces. Have we had similar experiences in the Western Cape, which you can share with us? And then lastly, one would think that many of the fires normally can be linked to human activities. Now, apart from the Verlorenvlei fire, can you give us an indication of what caused the wildfires that were experienced since the lockdown period started? I thank you, Chair.
Thank you very much, Honourable van der Westhuizen. I'll now recognise the ANC. Honourable Nkondlo, would you like to pose a question?
Yes.
Please proceed.
My questions are as follows. Thank you. My questions are as follows. In the first presentation on the waste management, I just want to check with the protocol mentioned, actually before the lockdown, can we just get an indication how effective has been your waste management, especially household waste management in poor communities? And I'm raising this because one would drive and would see, piles and piles of household waste, just littered in open fields, and that is still happening. So how has that been managed actually now during the COVID as a something that you find in mainly your poor communities? Again, my second question is that in as far as your environmental health practitioners are concerned, can you indicate, especially where in these areas we call them hotspots now, what is the ratio, to a target population of EHS practitioners that you have, and are there any adaptation strategies, especially in these particular areas, to curb, the spread of COVID at this point? And if so, can you provide us the detail to that extent? My last two ones is that in terms of what we have seen, in some of both the public and private workspaces, what could be, I'm not sure whether this particular department would have sent their environmental health, staff to those, and whether is there any indication of what could actually be causing the spread, especially in the workspaces, both in public and also in private facilities. And lastly, with the winter coming, what kind of measures are at place, especially to those informal settlements we know that are in the wetlands, where there would be potential or possible flooding of those areas, especially now in trying to mitigate the effects of COVID? Are there any particular strategies that could be shared also for us so that we can be able to understand and follow up in some of those informal settlements? Thank you.
Thank you, Honourable Nkondlo. Any questions from the EFF? It's really been on the line today. I then recognise Good. Honourable Heron, do you have any questions? I can hear you now, no, thank you.
I said I'm covered, thank you.
Thank you. ACDP.
Thank you, Chair. I'm mostly covered, but just one or two things that I want to ask. It was mentioned that where's it, the hotspots, the scorpions, the green scorpions, and the hotspots. Now with the restrictions, is it easier to put a clamp down on these hotspots, to concentrate on these hotspots? Is it easier because the gentleman said that with 216 green scorpions, we are blessed in the Western Cape, but I want to know specifically now with the regulations, the COVID-19 regulations, it's easier to monitor these hotspots and to act on these hotspots. Just the this expected 17 million that they will lose, and he says it's basically on maintenance. How will that affect the maintenance, and will they now prioritize to what's important and not? And just lastly, the air quality, it says that the air quality, 1 is very good and 10 is of course worse. But is that, if you now say air quality, and if you say air quality for the Western Cape, does it mean the entire Western Cape, or is there areas that can have a 2 or 3? And then do you look at the average? If they can, let's explain that to me. Thank you very much, Chair.
Thank you very much, Honourable Christians. HOD Minister, over to you.
Chairperson, I'm going to allow, I think most of the questions was directly posed to 2 individuals. If there's gaps, I will fill. I don't know, Pete.
Chair, what I propose is I'm going to just make two responses, which cover part of Member van der Westhuizen and also Member Christian. Firstly, the question of the extent of the death rate and the modelling and the forecasts. There's a highly sophisticated modelling process that originated in the Provincial Department of Health, linked into the national and also some of the academia. It's just been expanded to also bring the Actuarial Association overlay of their modelling and also a University of Cape Town process. So in as far as the modelling and the forecasts of the potential fatalities, I think that there is a science and a highly predictive model which has been established and which is informing a number of, if you recall earlier, Ida Barnard spoke to the fatalities management, and I think this sits at the heart of it. So in terms of, you shouldn't look at, for instance, just the management of the crematorium facilities and assisting the operators of crematoria in isolation. It is being dealt with intergovernmentally in that forum that Ida coordinates and also collaborates with the operators. Chair, I think the other question in respect of preparedness plans, I think that Colin did indicate in one of the questions earlier that the process is currently underway. I know that all the departments were called upon to make submissions by the beginning of this week for their inputs into preparing the Western Cape Provincial Winter Preparedness Plan. So certainly, as happens annually, the preparedness plans for each sector department, which is collated by the Provincial Disaster Management Centre into the provincial response, that process is underway to, on top of obviously dealing with COVID-19 at the moment, trying to manage or looking forward towards the management of the winter situation and particularly in the informal settlements. So I'm going to ask in rotation, perhaps Joy, Eddie, Vilna, and Arends just to answer the specific questions that were put to us. Thank you.
Thank you, HOD. Thank you for the question. I think HOD did a very good job in terms of explaining about the modelling and the expected number of deaths. So I think that question was covered very well by HOD. In terms of the maintenance and the repairs at the crematoria, so currently, in terms of that slide, it's the backup cremators. So the facility, it's the backup cremators, and then it's also one of the cremators. So we are in communication with the Maitland crematorium, the City of Cape Town, to get the information in terms of repairs. So we are working closely with them, and then also the licensing authority for the other facility is the City of Cape Town, and so also there we basically working with them also to establish how long and when those cremators will be coming on board. So definitely there's communication between us and the facility and the licensing authority in terms of the repairs. So we cannot give you an exact date now, as the repairs is in process, or at least the process is in place. And then in terms of the question on the air quality in the Western Cape from the SACWIS, so what you see on SACWIS is essentially the monitoring stations that have been selected by national. So that is not to report live to the app. And so that is not all the stations that we have in the Western Cape. We, as the Department of Environmental Affairs and Development Planning, we have 12 monitoring stations, and generally the air quality is good. in terms of it does not exceed mostly does not exceed the ambient air quality standards. And then also for the city of Cape Town, they have, I think it's 12 monitoring stations, 2 of which has now been decommissioned due to there's construction in the area, so you can't monitor because you're going to get a false report for that. And then also in the West Coast district, there's 1 air quality monitoring station which the West Coast district municipality is monitoring, and then also Saldanha Bay municipality is monitoring 2 stations, has 2 stations in their area. And in general, the air quality is good. And you will, if you look at basically what is happening, if you know, I'm sure you've read in the newspapers also when you see the modeling of the entire country, a pre-lockdown versus lockdown, you will see that there isn't very much big differences in the Western Cape, and that is really because the Western Cape's air quality is generally good. So, but we can definitely provide the annual state of air reports, which we do produce. It's also available online, so we can provide the links to the chairperson for giving to honourable members. Thank you. Thank you, HOD. Thank you, chairperson.
Thank you. I think that's a sequence to the honourable member of the DA. Thank you for your question, sir. Sir, unfortunately, as far as I know, and as far as I'm also a member of the International Solid Waste Association, we were not aware of any transmission that takes place because of the handling of household waste, but the risk is definitely there. So then, if ma'am, thank you for the ANC, honourable member, the question that you asked. I think compared to the rest of the country, I think our areas are quite clean, even our informal areas. But this is always areas that do need further attention. And if you look at our basic refuse removal rates, it's very, very high. But there's definitely the areas in the informal settlements that should get more attention. We did a study in the informal settlements, and we look at business models that work. And we're planning in this year to work very closely with municipalities to even escalate that, because there is where a lot of illegal dumping and pollution is taking place in that area. What we've seen, not necessarily in the informal settlements that I'm aware, but as a general increase of illegal dumping, quite a significant one, because a lot of the facilities are actually closed. Then for my sins, I am an old environmental health practitioner. But my role in this pandemic was to coordinate the waste management aspect of them. I know there's a World Health Organization ratio per population that's 10,000. Unfortunately, I don't know where the Western Cape at this stage slot in. There's definitely strategies in place to prevent the spread. There's a national hygiene strategy that was actually developed by the National Department of Health, which is implemented, which is very, very, very strict. We gave input into the waste management part to make it more practical. And unfortunately, I will not be able to answer the question in the private workplaces where transmission is taking place. What I can say there's also very strict directions and regulations now when people go back, where it'll be monitored. But from my environmental health point of view, I will not be able to answer that specific question. Thank you.
Arons, please come in. Sorry, Vilna, and then on to Arons.
Thank you, HOD. I think you've answered the question on the wetlands, so I will respond to the question on whether there's a risk to people that have to share soap in hand washing. I would say that that represents possibly a very low risk, because soap and using of hand sanitizer is very effective in inactivating the virus. so the actual sharing of soap, I think, is not the problem. However, in an informal area where people are close together, the difficulty with maintaining the social distancing and maybe touching of other surfaces might be more of a problem. But soap has been shown to be very effective in actually inactivating the virus. Thank you very much.
Aaron, if you can come on.
Yeah, okay, great. Thanks, HOD. Thank you very much for the questions. Also, in terms of the question around the frequency of roadblocks, yes, I think it is a great, fantastic opportunity to actually make use of that. I can just confirm that Cape Nature generally, we, in terms of the intelligence gathering part of any of the compliance and enforcement interventions we do, we usually do that in collaboration with the South African Police Services Stock Theft Unit. We've got a strong relationship with them. And so, for example, the two interventions in the Knasvlakte area were both done in collaboration with that. But I think the honourable member was quite correct in that it is actually is a great opportunity to make use of some of the more permanent roadblocks in this regard, in deploying EMIs in that regard. So I will certainly take that into consideration and actually feed that back to our teams. Thank you very much for that. Also, in terms of the members' question around the wild animals and the effect of lockdown, I think that's a general question and a general phenomenon worldwide, that we have seen that with obviously fewer people moving around, especially in your more remote areas, that animals have taken the opportunity to sort of explore a little bit wider. Unfortunately, we do not yet have any formal and significant evidence, that more and more animals are moving around. I fondly recall the Facebook videos that were posted by people in terms of and showing the penguins waddling through Simonstown and the boulders and so on. I think we have also noted in our nature reserves, especially in the Jonkershoek, Holland area, more small game moving about, klipspringers and those things, obviously with less people. But unfortunately, we don't really have any solid evidence. But I can just underscore the notion that wild animals and wildlife, generally speaking, would be more free to roam around. Here, in terms of the fires, the question around the fires, yes, I think we need to acknowledge that the most and the majority of fires that are started in the Western Cape and elsewhere are human origin. I just had a very quick look, and the information that I could get my hands on within the last 5 minutes is that of the 6 fires that we've experienced, there were the Verlorenvlei fire, a fire in the Witzenberg Mountains, as well as in the Jonkershoek, Asogaiboskkloof area, which are of natural origin, lightning and probably rocks, baboons, and so on. And then also 3 other of the reserves in Ganklo Pass, drift sands in the Viliersdorp area, highly likely to be of human or man-made or of human origin. I would like to then just quickly deal with the last 2 questions in terms of the green scorpions or the environmental management inspectors finding it easier to do their work. I would agree with the notion and the honourable member's remark that it's probably easier to move around. We have it on good authority that especially in the Betty's Bay, Royals towards Pearly Beach area, that the incidence of abalone poaching has dropped significantly. And obviously that is highly likely as a result of much fewer people moving around. But then also, consequently, I would suggest that it does make it easier for our EMIs to move about and to actually put up surveillance posts and everything. So I think that is certainly to be supported. And then the last question that I have in terms of the 17 million rand that we predict to lose, I think it's comfortable to report that the 17 million that we predict to lose would be part of, and the potential loss would be to our revenue for the first and the second quarters. However, I'm glad to report that our maintenance to ecotourism and other facilities will continue as it is on a separate budget, and that will be completed and done through the Public Works Department and the relationship that we have with them. Thank you, HOD.
Chair, I think we've responded from my notes also, so I don't think that there's anything outstanding from our side.
Maybe, Piet, Chairperson, if you just allow me very briefly, I think what the committee needs to realize is that when we plan, and I come to Honourable Andrika's question, then we plan for the worst case scenario. So when we talk high numbers, it's because we plan for the worst case scenario. That's normally what we do from a disaster management perspective. And then also on the 17 million rand cut, I think it's early days still. We must await. The President will make certain announcements, but I think also the Minister of Finance in his budget speech, we will get more clarity on the real cuts. And I think it will be a whole of government approach to re-look at what programs, what processes we need to follow to get through this. Thank you.
Thank you, Minister. I'm just going to check with the members. Are there any final questions to the department? DA?
Not from my side. Thank you very much, and thank you for the answers.
Thank you. ANC?
None from my side.
Thank you. Good.
No, thanks, Chair.
And ACDP?
No, Chair. Thank you.
Thank you very much, members. If we've exhausted the questions, then I'd like to thank the Minister and the department very much for preparing all the information that we requested in these presentations. And thank you very much too for answering our questions. We wish you the very best with the very hard and tough work that you have to do and in order to manage this crisis and pandemic. And we ask that you stay safe. Thank you very much. I'll then excuse. Thank you, Minister. I'll excuse the Minister and the departmental officials. We just have a few deliberations in committee to deal with. If I could then start with Honourable Heron, you said you wanted to raise something in the deliberations.
Chair, I mean, I'll raise it now. It's not really about the deliberations. It's really a question of clarity or some guidance from you. I can't find anything in the rules, but I'm trying to understand what is the process or procedure if one of the departments or a member of the department who presented to this committee has misled the committee. How do I, as a member who has now come across this information, how do I handle that?
Could I take advice and get back to you?
Yes, that would be appreciated. Thank you.
Okay, thank you. Then, members, we have a set of minutes to get through, as well as the program. I'll just find my note quickly. Before we get on to that, if there are any questions that members would still like to ask for both or either of the departments that were here today, as usual, please feel free to pose them in writing. If you could send them to the procedural officers by midday tomorrow, that would be greatly appreciated. Okay, by Monday. By Monday, then we will collate them and ask the Minister for responses. Then,
Chairperson.
Yes. Yes, Honourable
Chairperson. Thank you. Can I request that the chair with the support staff just consider, I think, in relation to how, with normally the 2 hours to 3 hours that we have online with this department, what would be the best way, of optimizing on time? I think considering the time of presentations, the time allocated to members, I think if maybe in the next meeting, you can just consider or present what could be the most efficient way, because sometimes we all want to participate, but they take longer. The presentations are long, and then sometimes the questions, I understand that in trying to manage all of this, we also want to have some questions. So I'm just saying, I think it's just one area in terms of virtual meetings, if we can try and manage that so that we lessen, some of the anxiety that takes place during the sessions. Thank you.
Thank you for that input. We'll have a look to see how we can do it. Some meetings, if we've got more departments, we'll have to try and make a bit longer. Otherwise, we can ask the departments to make the presentations shorter. So we will look at all of that. Thank you very much. If we can then just look at the committee program. Just so that we're all on the same page for next week. I'm not sure if one of the procedural officers is able to put the program on the screen, please. So I've made some amendments that I just want to test with the committee. There we go. Okie dokie. So we have the briefing on economic support and recovery on Friday, and then next week we have transport and infrastructure and human settlements. We had initially asked the Department of the Premier to come and present on broadband infrastructure, but on reflection and when we were preparing for the letters to go out, the broadband infrastructure does not go to private homes, so it didn't really fit with the requests of the committee, because the broadband infrastructure goes primarily to libraries and schools. So I have removed that then from that particular meeting because it just didn't make sense in that particular context. Then the 22nd of May, we have government finance and budgets and cooperative governance. We have asked the Premier and the DG to present there on the whole of society approach and coordination with other spheres. And thank you to those members that did provide inputs then on that particular theme. So we'll have both of those next week, Friday. And then we've included which departments we will call on the theme of citizen surveillance, that being the National Department of Health and National Department of Communications. Then just to flag, and I know we don't have much time today, but we can discuss it in another meeting, is when we move on to our citizen engagement program. I've tabled a discussion for the 3rd of June where we can have a look at how we can have public participation in the work of this committee. And if we are going on a constituency break, that would be an ideal opportunity for us to use that time to collect public inputs and submissions from members of the public. So just give it some thought, and we will continue the discussion, but that is ideally an element I'd like to include in the work of this committee. Are there any questions on that program?
Chair, van der Westhuizen.
Yes.
Chair, it seems as if there's a need for members to really ask a lot of questions, and we submit a lot of issues to the departments, and when they respond then in detail, we find that we don't have enough time for the questions that emerge from the presentations. And I would like to propose that we perhaps, where possible, then add another hour to this meeting, and that you allow us a 10-minute break in between, or in the middle of the 2 hour, after 2 hours. But I wouldn't like a repeat of what we've seen today, where members that would have liked to stay until the very end had to leave because they expected the meeting to end earlier. So my proposal would be that we consider also, when programming, to add another hour to this meeting, particularly when we invite more than one department to come and address us.
So it's also a question of feasibility, because that means we'd be running until 7 o'clock in the evening on a Friday. But also remember that if that's what members would like to do, we can try and do that. But also remember that some of us have, family issues where it makes it a bit difficult to do that. That being said, I would like to remind members that the work of this committee continues until, will certainly continue for a good couple of months into the future, until the pandemic is no longer a crisis. So we will have to call the departments back again and re-look at these issues because they are changing all the time. So it's not realistic for us to say, well, we had that department once and now we're satisfied. We'd have to call them several times. So what I'd like to do is, once we've dealt with all the themes, is then go back to them again and invite inputs from the members on, you know, what more do we want to know? What do we need to look at in more detail, etc. So we will layer it and continue and deepen our understanding and our oversight as we go along. So I hope that allays members' fears that the departments are not only going to appear before us once, we will have many opportunities with them, and we will, and I will invite the members again to submit which ones and how they'd like it done and what they'd like to be included in those programs. I hope that makes sense. Honourable Christians.
Chair member questions. Yes,
yes,
Chair, just yeah, thank you. I think the one thing is if we get, I think Member McContlow said that, if we get the presentations, you know, in advance and we go through it, the department don't have to go word by word. That is the first thing. And the second thing is if it's you know, we will have to try maybe just then to reduce the number of departments coming in order to give members the opportunity to ask more questions. So maybe the presentations can be shorter and then members can then ask the questions. But I don't agree with another hour. I mean, we have other responsibilities and like you say, there's other things besides this committee. Thank you, Chair.
Thank you for that input. So we will then ask the departments to make the presentation shorter, on the understanding that members have read the presentations, so there'll be more time for questions. And also then we will open up further rounds for the grid so that we can again deepen our oversight and knowledge and understanding of what's going on with each of the departments. So thank you for those inputs. Can we move on to the consideration of the minutes? We're going to look at the 6th of May, Wednesday, the 6th of May. Do we need to call them up, or do members have it?
Chair, we have the minutes. I just would like to propose that we move to support.
Thank you. So, and can I have a seconder for the 6th of? Thank you. Thank you, Honourable Bartman and van der Westhuizen. Then the minutes of Friday, the 8th of May. Can we adopt those?
I will propose that we adopt.
Thank you, Honourable van der Westhuizen.
Second, Chair.
Thank you, Honourable Philander. Thank you all. Our next meeting then is on Friday, the 15th of May, on the theme of economic recovery, support and livelihoods. Thank you very much, members, for your very keen participation in the meeting. I hope you have a good evening and please stay safe. The meeting is now adjourned.
Thank you, Chair.